Раз, раз. Раз, два, раз, два. Добрый день, коллеги, слышно?
Да, всегда хорошо тебя слышно.
Прошу прощения, еще раз проверяю.
Вы слышим хорошо.
Ира мьют мекнемо, русский шагиро мекнем, а я уже модern мекнем. Да, я вот мьют сделал, да. Не, вот так пусть стоит. Зачем нам сейчас оригинал аудио, правильно?
А что здесь? Да, Ваюда Мирова Мудана, оригинал. Да? Все,
Мьют мекнем, да. В крайнем случае, мекшим кого там. Тогда оставим, но где-нибудь что? Я выпущу его.
Уважаемые коллеги, прошу внимания. Уважаемые коллеги, я вас...
Dear colleagues, I would like to welcome all of you. I would like to welcome all the participants who just connected from Bishkek, from Kyrgyzstan, from other parts of Central Asia and from other parts of the globe. It's really great that the third part, or the third day of our conference has basically shifted to Bishkek. And I hope that our colleagues from Uzbekistan, Tajikistan, and Kazakhstan are also present here. I don't see, unfortunately, how many participants are right now online, but offline, our team, I can say, is present in full extent, and we have here all the partners that are trying to do their best in TB control. Distinguished colleagues, I hope that you do hear me well. Please confirm. Do you hear me? Colleagues online, please. Yeah, we hear very well. Thank you. Okay, let's continue then. From time to time, I will be clarifying and checking, because I really would like that all of us would be heard, to all participants in today's conference. So it's the third day of the conference, the fifth international conference on integrated TB control in Central Asia. And the third day will cover the issues of financing. This is so-called the virtual study tour to Bishkek, to Kyrgyz Republic, to several organizations. The heads of these organizations are present here, and I hope that our today's discussion will be very active, very vivid, and very interesting. I hope it will be interesting for all participants that are present both online and offline. And for the beginning, I would like to... I'm not going to introduce myself first. Let me first introduce Aynura Sultanova. Aynura Sultanova Ibragimova in Kyrgyzstan, most probably the ones who work in the health sector, they know her very well. And those colleagues who are online, I would like to mention that Ms. Aynura Sultanova is very prominent strategist in the area of health. And I can say that she's working right from the first days of establishment of the health system since the first day of independence of Kyrgyzstan. So to a great extent, health sector is related to the name of Ainura. Well, she was very modest in presenting her biodata. She just took put the two phrases: the former Deputy Minister of Health and the former Director of Obligatory Health Insurance System. I should say that Ainura was also on the front line of development, and the ideology of the insurance fund was well embedded and implemented thanks to Ainura's efforts. So therefore, our today's session, specifically in terms of the financing, Ainura will be moderating. Of course, financing is a big part of activities, and it's really great that Ainura Sultanova is in the front line of TB control in Kyrgyzstan. So with great pleasure now, I would like to give to Mrs. Ainura as a moderator and co-moderator of our today's session. Please, Ainura. Oh, thank you very much, Mr. Murad. Good morning, distinguished colleagues that are present in the room, as well as in the two rooms, I should say, as well as the ones who are just connected online. Today we'll have two moderators. I have been just introduced by Mr. Murad, and I would like to thank him for such kind introduction. And the second moderator of today's session is Mr. Marat Kuliyev, who is also used to be the former director of the fund of the obligatory insurance, and also she used to be the Deputy Minister of Health. So it's quite an interesting representation of the team of moderators today. Well, actually, Mr. Murad also has vast experience of working in the health sector, more than 25 years, and more than 11 years he works in the system of financing, and he's the doctor of medicine. And actually, Mr. Murad is one of the main persons who demonstrated a great political will, because he used to work as the chairperson of the fund of the obligatory insurance when we are launching these very financing mechanisms. And we're going to share with you the results of this very fund. So actually, he's very much committed. He has great political commitment to this very work, and shouldn't be he there, I don't think that we'll be able to meet today. So the second moderator of our today's session is Marat Kuliyev. And now let me give the floor for the welcoming speech to our distinguished director of the National Center of TB, Professor and Doctor of Medical Sciences, Mr. Baratayev, who is also one of the greatly recognized person who made a great effort in reforming the health sector. For an extended period of time, he used to work as a Deputy Minister of Health, and while he was on this very position, he was the leader, along with Mr. Marat Timurbekovich, to launch those very areas of activities that we'll be talking today. So with great pleasure, I would like to give the floor to him. He's the member of our panel, please. Thank you. Thank you, Ms. Ainura Sultanova, for such very kind and warm words. Good morning, distinguished colleagues. Let me, on behalf of the TB Service of Kyrgyz Republic, to welcome all of you in the 5th International Scientific Practical Conference. And let me extend my thanks to the organizers of this very conference for such superb arrangements, represented by the Ministry of Health of the Republic of Uzbekistan. USAID, which has greatly assisted through its project to arrange this very conference. As you may be aware, the conference, Scientific Research Conference, is a kind of a platform where we can share our accomplishments, our results, where we can say to each other and share with each other our friendly, critical statements, as well as we look forward for the specific proposals from other countries. Today, it has been already mentioned that we'll be speaking about learning the experience of Kyrgyzstan in financing TB service. As you know, recently we have been to one of the families of the Central Asian big family. We had a similar system of financing. However, for the last 2 days, having listened to the presentations of our reporters and contributors, I see that we have almost similar problems. And we need to coordinate our efforts, our aspirations, so that we can seamlessly go through this very problem to improve and to detect the diagnostics and what is the most important, the treatment and reduction of the prevalence of the TB. Kyrgyzstan, I believe, one of the first countries that launched the changing of the financing in the health sector in overall. So I was happy enough to get to work with Mrs. Ainur Sultanova on the horizons of the reforming of the health sector in our country. And one of the most important issues was how we can ensure the relevant financing in order to attain the expected goals. So, as you may know, this is not only the deficiency of funds. The most important is how effectively we can disburse these very funds, to what extent we can strengthen the prevention activities, so that what should we do and what we can do that so the people, TB positive people, will feel themselves better, they will be cured, and they will join our society. So I would like to call all our colleagues, especially the ones from the other countries, from Tajikistan, Kazakhstan, Uzbekistan, Turkmenistan, the ones who are present here, I mean, the international experts from these national organizations. Please, I would like to urge you for active discussions so that we will know where we are not attentive enough or which issues are to be a priority. Well, I'm not going to make a long speech. I believe that there will be good speeches later from our contributors. So I'd like to call you and urge you to actively participate, actively discuss, and we're ready to answer to all your possible questions. For us, it's really interesting. It could be, I mean, the questions from other countries. And let me wish all of you successful work. Thank you. Thank you very much, Mr. Mladen Mushayevich. Distinguished colleagues, our today's session is dedicated to the financing, and I would like to give the floor to the Deputy Director of the Fund of the Obligatory Insurance Fund, to Ms. Clara Turgumbetova. Ms. Clara has great experience of working with international organizations, with the USAID projects, with the World Health Organization projects. And the greatest experience she has is working with the World Bank project, and she was the head of the project of financing based on the results, which was quite a prominent and famous project, which has been recognized with great results. And many of these very outcomes have been well institutionalized in Kyrgyzstan, and it has been well represented in the international practice. Currently, she is she's in practical activity regarding the health insurance, the quality of health sectors, health services. She's the coordinator, and she organizes her activities. Please, Mrs. Clara Turgumbekovna. Thank you very much, Mr. Marat. Good morning, distinguished participants of our 5th International Conference on Integrated TB Control. Let me, on behalf of the Obligatory Insurance Fund, I would like to welcome you. The fund carries out the unified activity on accumulation of the funds and financing of activities of health institutions. And of course, we and nobody else is very much interested in all advanced practices in the TB control, because it's very much related to the quality of the health services, as well as to the issues of effective management of financial resources. As you may know, the coronavirus pandemic basically has impacted all our activities and suspended many activities that we were planning. And in this regard, we sincerely hope, and I would like maybe to repeat the words of Mr. Marat, we sincerely hope to look to receiving your comments, your recommendations, and we'll be gladly presenting our outcomes and the results we have attained, and we'll have a good discussion on them. Thank you. Thank you very much. Well, and on behalf of the Ministry of Health, I would like to give the floor to supervisor of the TB system that operates in the anti-TB activities sector. Mrs. Kamchibekova. Thank you very much. Good morning. Good morning, distinguished participants of the 5th International Conference. Distinguished Madam Musayevich, Mr. Ainur, and distinguished participants. On behalf of the Ministry of Health and Social Development, I would like to welcome all of you, especially my colleagues from Uzbekistan who organized our today's conference. For the last 3 days, they have made a great effort. Definitely, the USAID project on TB control is a very important project, and our ministry is an integral partner of this very process. Specifically, the TB control. We're engaged in detecting, as well as the testing and treatment issues, as well as it includes the activities of the improvement of labs. And I would like to wish all of you great successful work. All of my previous speakers have already mentioned about the activities. And I would like to wish all coordinators and all our visitors from the regions, I would like to wish you a productive day and active participation, especially in discussion section. Well, of course, there are some intergovernmental problems that we can resolve together. We can do it in Central Asia, sure. Thank you. Thank you, Ms. Anna Kamchibekova. Distinguished colleagues, we presented and introduced you our expert panel, and the panel has welcomed all the conference participants. And the next floor goes to Mr. Erik Ringing, the senior expert of the Associates Organization on Development. He is in charge of the global health and the global development. His experience is more than 25 years. This experience includes the issues of the system of health, water resources, gender equality, agriculture, economy, digital transformations, political economy, and governance. Practically everything, I should say, everything and anything related to the system of state management. Eric has worked in 65 different countries of the world, and Mr. Reading has 1,600 offices that work currently in 45 countries of the world. And currently, he is coordinating the long-term strategy in the area of global development. Distinguished Eric, please, floor goes to you.
Thank you very much, and welcome to the participants of the 5th International Conference on Integrated Tuberculosis Control in Central Asia. On behalf of Appet Associates, who's the main implementing partner of the USAID-funded Eliminating Tuberculosis in Central Asia project, I'm very pleased to welcome you to day 3 of the conference. This third day of the conference will be dedicated to approaches and experience in advancing broad health finance and TB-specific finance in Kyrgyzstan. The fight against TB is facing significant headwinds to achieving the United Nations goals of eliminating tuberculosis, and the most challenging of these are relating to finance for tuberculosis. The costs of TB care are increasing due to a variety of reasons, such as fast-growing resistance to existing drugs, growing complexity of care, high cost of drugs, particularly those resistant to drug-resistant TB. The overall funding for TB from international donors is declining, and the fight against COVID resulted in the relocating critical resources from tuberculosis to COVID. USAID EDICA provides technical assistance in health financing activities, particularly in TB finance in Tajikistan, Uzbekistan, and Kazakhstan. The USAID EDICA project builds or strengthens the Central Asian countries' capacity for self-reliance in planning and optimization of resource allocation. Thanks to all of you for your attention and your fruitful discussions. And I wish you a great exchange of experience, as well as in your future work in overcoming TB through an accessible, affordable, effective, and efficient tuberculosis program.
Спасибо.
Thank you, distinguished Mr. Eric, distinguished colleagues. I would like to provide you some information about the structure or the agenda for today. As you may know, our conference is happening in a hybrid mode, online and offline. And this type of hybrid approach creates certain peculiarities how to carry out the event. Our wish, and we wish that the meeting should happen very interesting for all parties, for the ones who will be presenting information, and for the ones who will be listening and who will be perceiving this very experience. We have a chat box. Please put all their questions in the chat box during the presentation. Also, in case when we'll be conducting discussions, you can raise up your virtual hand so that our technical assistants can give you the floor so that you will be audible. Distinguished colleagues, we also have WhatsApp channel, especially for the ones who have some other maybe technical complexities to ask questions from the chat box. So you can use WhatsApp. Rahat Timurova is in charge of coordinating the communication channel by WhatsApp. In the chat box, you can find her phone number. So please, you can direct your questions to this very number and comments, of course. We will definitely take note of them. And distinguished colleagues, unfortunately, after every presentation, we cannot conduct the discussion because of some technical issues. But I believe that having listened to all our presentations, we'll have a good chance to share impressions and to make the comments and recommendations. Please do not forget to raise up your virtual hand so that we can synchronize the process. So let's continue our conference. Ms. Anura, please. Thank you. Yes, distinguished colleagues, let's start. We are off. So the first presentation, the overview of the anti-TB service in the Kyrgyz Republic, will be rendered by Mr. Karatayev, the head of the National Center of the TB Service of Kyrgyzstan. Thank you very much, Ms. Ainur. Before going to the issues of financing, let me provide you some overview about the situation on the TB service in our republic and the financing programs. First, I would like to say a few statistical data on this. As you may know, we have certain decline of the prevalence, mortality, and morbidity in Kyrgyzstan. And the trend, I should say that the recent events of 2020 and the early 2021, because of the coronavirus, there is a dramatic decline of the prevalence. I'm not going to repeat this again. We have been stating that probably the reason is that the low detection and the low referral. And as you know, today we have 78.9 per 100,000 of population as of 2019, and the mortality rate is 3.9 per 100,000. But as you can see, starting from 2021, there is a trend of decline, and I believe that in this regard, we will definitely continue our efforts. The system of rendering anti-TB service in the Kyrgyz Republic has a three-tier system. It's mainly the National TB Center, which is the treasury institution, which is in charge of the coordination and introducing TB programs in the country, which renders specialized TB services. And we have at the regional level the centers.
So provincial centers organize and implement TB control activities in the process, and they interact with the primary healthcare level directly, and the very basis not only for TB service but for the health sector overall is primary healthcare. And here we are discussing detection, diagnosis of TB, treatment, and finalization of treatment of TB patients. They are responsible for treatment of patients in the district and respectively at the primary care level. So at the level of family medicine centers, so ex-polyclinic. So we have TB rounds and TB doctors available, and at the primary level, they see patients, detect TB, and from there, we start reporting upwards. So as for TB control program of Kyrgyz Republic in the context of the global strategy, so we split it into 3 stages, and actually, so TB5 program is being completed this year. So we are preparing for TB6 program, and so this is about the phasing. So starting 1996, that strategy was adopted about adherence, diagnosis, microscopy, standard treatment regimens, drug supply, and recording and reporting systems. And as you are aware, in the early days of independence, the TB incidence and mortality went up drastically, as well as incidence of other diseases. And definitely we needed a standardized treatment regimens and experience of international organizations to stabilize incidence rates, to decrease mortality. And that's why, having reviewed that experience, we initiated this program. But what's most important is that starting 2006, we can say that it became stabilized. And as I said before, starting 2001, the rate went down, but actually stable decrease is what we saw starting 2006. And hepatitis and other diseases, the same is true for them as well. So here we plan strengthening the health system, providing more opportunities for patients, and also implementation of scientific advances, as well as achievements of other countries, and introduce them to treatment programs, thus reducing mortality and morbidity rates. And here we are discussing the tactics and strategy of eliminating TB. Why I'm saying tactics? Because we reviewed gaps in previous programs, what required attention and what rates, what indicators were of importance for us, so we could eliminate TB. And mostly starting 2015, we focused on patient-oriented approach and innovative strategies and system support and innovations and research. So like, what the programs were supposed to have, which goals and objectives they were supposed to reach. And based on that, we were changing the indicators so we could achieve further improvements in the context of new global TB control strategies. So TB program, as I said before, now TB5 program is in progress, and its primary objective for the period 2016 to 2021 is to prevent further spread of TB with drug resistance and further decrease of incidence and mortality as a result of all forms of TB. This program was developed in line with the major priorities of of the program designed for WHO European region for subsequent years. And TB5 included the following priority areas. So the very basis of it all is prevention. We should prevent transmission. We should prevent the spread of TB further to other segments of the population. Improvement of TB diagnosis and detection. So what we are talking here is detection. And let me say from the very beginning, in Kyrgyzstan, we are having high level of migrant flows, and many citizens of our country work in other countries, and that's why of importance here is detection on site. And due to lack of material and technical resources and infrastructure at the primary care level and lack of human resources, we really were having issues to ensure transportation of specimens. So, and now the National Reference Laboratory is providing high level of diagnosis, but back then we couldn't organize the laboratory service in each and every province and district, and that's why the issue of transportation of specimens was important. So to provide more effective treatment for TB patients, to provide high quality TB drugs, and enhancing what we call provincial TB concilium. So I'm not going to discuss plans. You will get more detail later, and you will see the video to what extent and how it is working now and what needs attention. So, and most importantly, here we focus on TB treatment and shaping the patient-centered treatment model, and that's new. So it's not only about TB service and the health system, and other communities and systems need to be engaged, and they channel their efforts towards that. Enhancing interaction with the civil society and TB control, and we introduced the state social order in the health system. I will give you more information on that later. And you know, dear colleagues, that an important point here is TB prevention. From 2017 to 2019, the country saw high immunization coverage, more than 97%. In 2020, the immunization coverage accounted for 96, slightly decreased. And we also pay attention to chemo prevention, mostly for children under 5 and HIV infected. TB contacts, as the share of those enrolled in preventive treatment among children is 85%. And so the TB reporting system doesn't collect data for those who completed system, so 85% is good, but there is no room for complacency and among children. So children should be our priority, and we need to consider the health status of our children so we could cover with preventive treatment the children in need, and availability of tuberculin and preventive treatment drugs from the state budget. So I will tell you more about the budget later. Improvement of TB diagnosis. The country introduced rapid diagnosis techniques, what we call GeneXpert. We have 24 GeneXpert machines in all provinces of the country. Starting 2017, genotype MTBDR, so HIND test, was introduced for second-line drugs. Starting 2019, the DST methodology was introduced for bedaquiline and repurposed drugs. Telomonid, clofazimine, and linezolid. And in the country, nationwide, we have the specimen transportation system, and we are having issues here in the south of the country. In Osh Provincial TB Center, we plan to open these southern laboratories so we could improve the rapid transportation of biological materials, and so we could ensure early diagnosis. So on a pilot basis, so we introduced quantiferon testing and MTB genome sequencing. The National Reference Lab under the National Center provides drug susceptibility testing, or DST, for the whole country, and specimens are transported to the National Reference Lab via the transportation company, and the National Reference Laboratory is well equipped with modern equipment to ensure it to be diagnosed. So here we showed specimen transportation. For other countries, I would like to inform you that so mostly we use roads and vehicles compared to air, and so we are talking thousands of kilometers, and more than 80% of Kyrgyz area is mountainous areas. And the transportation model was developed in 2017, so it proved its effectiveness in the pilot format, and starting 2019, the biomaterials transportation system and the transportation of TB drugs was expanded nationwide, and so we outsourced transportation services, and here the transportation system for 2 provinces so far is funded from the state budget. The rest of the provinces, yes, the global fund resources, and taking advantage of this opportunity, we would like to extend our gratitude to the global fund. The third area is improving TB treatment. So there was the transition, so almost 100% of procurement of first-line drugs are now procured from the state budget, previously from the global fund. So it's 32 sums, and we are starting state procurement of second-line drugs. So we started in 2018 from 20%, and gradually we are moving towards full financing. And I'd like to state that our economic status, and I would like to highlight it, so our international partners could know. So per capita financing of health system suggests that we have one of the lowest rates in Central Asia. And so we have the essential drug list, and it includes WHO recommended TB drugs, and the country registered 14 TB drugs pre-qualified by WHO, and we have accelerated registration procedures, and also 2 TB drugs are in the process of being registered. And in 2020, the practical guideline for TB drug management was developed and introduced, including various drug management components. And so this is what we've discussed. This is what I mentioned in the very beginning, enhancing TB concilium. So starting 2020, the provincial TB concilium began to be implemented, and the pilot was initiated in Chui province. And starting 2021, we are implementing reforms in Tashkent, Talas, and Narin provinces, and district TB doctors working in the primary healthcare level. They are engaged in decision-making as deputy concilium chairs. And the concilium member functions were expanded. So the chair or a deputy chair is responsible for a TB case verification. So you will have a special presentation on verification and submitting claims for payments. And also they coordinate provincial institutions in the TB patient support for those at risk of loss to follow-up. And the secretary is responsible for submitting patient data using electronic TB register. And also we introduced the cohort analysis and TB concilium operations and capacity building for concilium members. So the modular program was developed for them, and training is also in line with the concilium requirements, 72 hours. And the treatment of TB patients is one of the most important points, as you know. So clinical outcomes depend on a number of factors, and to decrease incidence and mortality, we need to enhance the efforts to ensure improved health status of our patients. So the treatment relies on the latest WHO recommendations, and the regimen relies on DST results. So we have individualized regimens and shorter regimens. And as part of the operational research currently in Bishkek City and in Chui province, we are introducing the modified shorter DRTB regimens, fully oral for adults and children, and also BPAL regimen for adults. The results of drug-resistant TB forms, the cohort 2017 so has demonstrated high treatment success rates for rifampicin-resistant and MDR TB. So in shorter regimens, it's 81.3%, and individualized regimens, including bedaquiline, 70.9%. So as for XDR TB, treatment success given individualized regimens with new TB drugs is 61.3%, and without new TB drugs, it's 24%. So the most demonstrative results are in children, 84%, as the lowest results are in HIV infected. Unfortunately, it's 37.3%, and we have to pay attention to that. So the outcome, treatment failure, and diet and drug-resistant TB patients account for 7.9% and 10.5% respectively. Unfortunately, loss to follow-up is 20%. Yeah, that was especially evident in the latest period in 2020 and early 2021. The highest rates of those for interrupted treatment with XDR-TB given individualized regimens without bedaquiline, without those drugs, is 32%, and the low treatment success rate in patients with co-infections are associated with higher level of mortality due to other countries, 22%. And what I mentioned before, designing patient-centered treatment models. So we developed and introduced the TB case management approach at the level of primary health care. The objective is to improve the treatment outcomes for each and every TB case and to reduce the TB transmission risk. So case management includes three areas: patient-centered treatment organizations, social assistance, video supported treatment, adherence to treatment, evaluation and monitoring, and psychological and social support during treatment, clinical monitoring of adverse events. Number 4 is enhancing interaction with the civil society in TB control. For that, to ensure uniform and coordinated information to be disseminated to the population, 12 key messages on TB were developed, and information is disseminated via reliable channels on a regular basis, and the social mobilization process engages both local authorities, NGOs, and religious organizations. As for state order introduction in the health sector, mostly it began in 2018 to implement the state program. The program was developed for the state social order for 2018 to 2020. For that, the standards for services were approved as part of the implementation of the state social order, and the Ministry of Health approved the action plan to introduce the state social order for 2021 to 2030. And what strategic areas we have included to ensure further development of TB control system: improved detection and diagnosis of TB, more effective use of new TB diagnosis technologies, and further improvement of the quality and outcomes of TB treatment, and enhancing TB prevention, enhancing health systems. Development of the following TB control program for 2022 to 2026. So here we established the working group, including the key partners and stakeholders, approved by the order of the Ministry of Health in February 2021. Taking advantage of this opportunity, I would like to extend our gratitude to international organizations and our partners for providing roundtables and seminars so the working group could have an opportunity to
so that we have
prepare the good program.
We have carried out the activities by the technical group in these priority areas. We have conducted the analysis problem. We have discussed the opportunities for the further development. We agreed on the goals, tasks, and the priority areas of the program. We have also planned the public discussion and finalization and approval. I believe that in the near future, we will go through that so that by 2022-2026, we'll be able to develop the program of a TB6 program. that will cover all the opportunities and the possibilities. And what is the most important, that the program should be targeted to the patients, so that we can say in a full-fledged manner that we are on the way towards eradication of TB. Thank you. Thank you very much, Mr. Madamin Mukhtaevich, for such very detailed and strategically well-weighted report that practically covered all areas of development of the anti-TB service activities. And certain parts of these various sections will be presented in the other presentations. You have presented the comprehensive approach carried out in our country, and majority of the components have been presented in the course of this very 3 days of conference. So I think that you have taken good advantage when you were presenting a number of the issues in the previous sessions and today. Thank you very much for that. I would like to wish you great success in implementation of the programs that you mentioned in the last several slides for the upcoming years. National Anti-TB Service, or TB Control Service. Distinguished colleagues, I'm confident that there will be questions that you would like to ask. So I would like to remind you once again, you can go ahead and type your questions in the chat box. So upon completion of the session, we'll try to do our best to answer. Even not by the end of the session, definitely by the end of the day, we'll definitely try to summarize all the questions and we'll discuss them. Questions that we'll receive through the chat. The next floor goes to Clara Turgumbekovna. She already made a welcoming remark. The deputy chairperson of the fund of the obligatory medical insurance on the policy of the unified payee to finance the TB control service in the Kyrgyz Republic. Please, Ms. Clara. Thank you. Good morning once again, distinguished participants. Well, let me present to your attention just a brief overview about the policy of the unified PE to finance the TB control service in Kyrgyzstan. As you know, the obligatory health or medical insurance is the fund which is basically called to accumulate the funds that we receive from the Republican budget, and to carry out the uni-channeled financing to organize the health sector. As you may be aware, in the end of 90s, when the financing to health basically has reduced from 3% to 1.9% in 99. So at that time, the health sector has faced a very important issue, like where to find the additional financing. And at that time, we have introduced the obligatory medical insurance. The obligatory medical insurance was the situation when the employer allocates 1% from the payroll to provide insurance, health insurance for the employees. It's a sort of the social protection, which is targeted to provide the Kyrgyz citizens with the quality medical assistance within the framework of the state health programs. The introduction of the obligatory medical insurance basically helps to avoid the possible financial crisis in the health sector, and it also allowed to launch the large-scale reforms in the health sector when we tried to pilot the new financing schemes. In 2000, when we have increased the obligatory medical insurance to the medical system, we started to feel certain contradictions. When on medical insurance, we used to pay based on the results for every treated cases. At the same time, from the Republican budget, the funds have been allocated to finance the bed pool. So at that point, the health sector has faced with an issue of introducing unified rules for payments for the services, for the health services. So at the Republic level, we have basically initiated this very fund. So if you look to this very slide, according to the scheme, the transfer of funds from the obligatory medical insurance fund to the district funds, it took us about like 5 years. As for the capital, it took us about another 6 years, so that all funds have been well accumulated only by 2012. So when all the funds have been accumulated in the funds of the obligatory insurance, the unified payees also started to join from the specialized organizations. The first one was the organizations of the TB control service, and then later we included the specialized organizations of oncology and the mental health. So by 2015, all organizations of health which render medical services to the population have been given in terms of financing to the obligatory medical insurance organ fund. At that time, in Kyrgyzstan, we have been experiencing quite a large-scale reform, basically of the entire system of the state financing. And we have developed the budget code so that within the framework of this very initiative, we have carried out significant work, and now the budget of the fund of the obligatory medical insurance is well indicated in the relevant laws and regulations of Kyrgyz Republic. The major areas of the activity of the fund is the implementation of the program of the state guarantees that defines the amount, terms, and amounts of rendering the services to the Kyrgyz citizens. In addition to that, there is another program of the preferential medicine supply to the population on the outpatient level, both that covers both the insured citizens and the specific category of patients with the specific diseases. As you may be aware, the payments on the treatment and for the result is indivisible from the quality control of the medical services or health sector services. The financial resources should be targeted only to ensure the quality of the health services, and the payment should be adequately. Therefore, one of the major areas of the activity of the fund is improvement of the system of the quality control of health services. And of course, the life is not standstills, and there are a number of other programs, other different initiatives, which is also includes the engagement of the fund. So why TB control service basically has been shifted to the fund of the medical insurance? There is always a question like a rational use of the financial resources. So therefore, when such shifts from the bed pool fund to the cured or the treatment approach, it helps to optimize in this very TB hospitals, as well as it gives a financial autonomy to the health organizations. Later, you will get more detailed information on this very program, but I should say that the financing is carried out by the organizations on a non-item based approach, so that every organization independently distributes and allocates their funds depending on their needs and their priorities. And of course, there is another issue of improvement the quality of the safety of the treatment for the TB patients, as well as the reduction of the duration and reduction of the level of non-justified hospitalization. And of course, we try to allocate more funds for the outpatient treatment. And as Mr. Marat has already mentioned, today we are procuring anti-TB drugs of the first line at the cost of the state. This again became possible as a result of the shift of the TB organizations to the fund. And also, we have another good chance to finance the lab services and to develop the new methods of financing of the TB control services, depending on those very issues or depending on those very needs that we face in the light of the modern realities. And we're also developing and implementing the modern systems. So in this slide, you can see just a brief snapshot of the results that were gained as a result of the services. Until 2012, the financing of the TB hospitals was based on the item-based approach, which means that the number of the beds And when we have shifted it to the fund of the medical treatment, we have issued the relevant resolution of the government. So another important issue in this resolution includes that all funds, all the institutions are basically can optimize their service resources, and the released funds should not be returned back and should be used again to optimize the service. So considering that we had a very detailed small number of the statistics, therefore the system of payment until 2015 was defined by very simple gradation, like the level of severity. We had two ratio on the costs, but the time again is not standing still. So within the last 3 years, the fund was able to accumulate quite a big amount of statistical data information on services rendered by the anti-TB service, so that by 2015 we were able to recalculate the ratio of the cost of the treatment for different severity level, and we have like 10 different DRGs right now. So currently in the Republic we have approved the roadmap or the action plan on optimization of the system of the anti-TB assistance until 2026, I'm sorry. So unfortunately, the last year, because of the pandemics of the coronavirus, certain activities has been suspended, but nevertheless, we hope that it will continue it in the near future. We have been also speaking that any system is impossible to operate without a well-developed informational system. So therefore, in 2017, we have introduced the electronic patient cards in the anti-TB hospitals. And in 2020, we have, it's again a good novelty, we have introduced a new per capita based financing for implementation of the function of coordination of the national centers of financing of the fund. So here you can see the ratios of the costs that we use in the process of payments. Prior to that, we have been speaking that the optimization of the bed pool, but if you look, next slide, please. If in 2015 that we had 24 hospitals, in 2020 we have 21. So we can see the gradual reduction of the bed pool. And we have also been mentioning about the non-justified hospitalization. Look at the cases of the treatment or cured cases. There are also a big number, as you can see again, we're showing on the slide how we were able to reduce the cases. That was prior to 2015, prior to the implementation of the new unified system of the payment. And there were a lot of non-TB cases has also changed. Again, the implementation of the new clinical cost-effective method helped us to identify those types of diseases and the cases of treatment. If until 2015 we had sensitive or resistant sustainable form, until 2015, as you can see, it's more detailed kind of a gradation or the classification. Well, as you understand, the issue was not only like to preserve the outpatient treatment system, but also to optimize the TB control services. So we have used very innovative solution in this regard. We started to refocus or to shift the focus of the TB service to the outpatient system. If prior to that, the outpatient treatment was carried out with a framework of the general per capita based system of the primary care. In 2017, we have developed the phase-based new system of the payment for the successful cases of treatment. But for that, of course, we have developed the relevant informational programs. But as you understand, the system of payment is impossible without the system of verification. Therefore, after that, we have developed the system of verification, like detection and the confirmation of every case. So every system emerges new issues, and the fund also started to deal with the transportation of the biomaterials. But for that, of course, you need financing. So therefore, starting from 2019, we have introduced the financing for the transportation of the biomaterials into regions. And as Mr. Marat Musavich has mentioned, in other regions, we're still using the funds of the global financing from the global fund. So today, considering that the anti-TB services are the part of the state guarantee program, we were able to define the specific 12 successful studies that should be carried out by the anti-TB service. In 2021, we have also introduced the program of TB registry program. The payment for successful completed treatment of TB on an outpatient system, first of all, was targeted to improve the quality of management of every case and to attain the positive result. But this assumes that they should be well-controlled treatment of the TB case. They should be a well clinical monitoring and clinical assessment of undesired reactions. That also includes the working with the patients. It should be the monitoring of commitment of the patient or the adherence of the patient to the treatment. It also includes the psychological and social support. And another important factor is the reduction of the risk of transmission of the TB. As well already mentioned, the payment for the TB case, for successful treatment of the TB case at the outpatient level, it's always based on the fact that every case should be treated or successfully completed. As such, they should be met all the functions on the TB case management, which means that every health professional participates in the management of the patient until the point when we consider the patient is well treated. The payment for the outpatient treatment of the TB is differentiated considering the complexity of the case. It can be divided into the sensitive TB and resistant TB. And also we have differentiated on the level of engagement of the health professional in the process of treatment of the TB case. The source of financing is the state or Republican budget. Well, this is also the process which happened in a phase-based approach. In 2017, we have started to pilot in certain regions, specific in Chuy region. In 2018, we have included the Talas region, and specific district of Karasu, district of Osh or region or oblast, which is quite a large district in our republic, I should say. Its population is more than collectively Talas and Narin regions. In 2018, we have included certain districts of Jalalabad Oblast. In 2019, we have continued to include the other region districts of Jalalabad. And this year, we have included Narin and Batken Oblast and one district of Bishkek City. So on this slide, we just wanted to demonstrate those lab service studies that were supposed to be rendered for the TB patients at the level of the program. Well, as I already mentioned, every novelty creates new requirements, new needs before the fund and before the TB control service in order to change the approach for financing. So when we have been introducing the system of outpatient treatment of the TB, we have faced with the specific issues about how to transport the biomaterials, which means that we needed additional funding for this. We needed the targeted funding so that we can ensure the issue of the safety and security.
That's why we piloted this mechanism in two and the last provinces jointly with USAID project. We established the logistics system just to see its time and so time for transportation, and by trial and error, we established it. So we used outsourcing and the special communication service was engaged. And in fact, we managed to establish control over that because contractual relations are easier to monitor, and also there was low cost, and we managed to ensure a timely delivery of drugs for TB patients. We all understand that outpatient treatment for TB patients is a process that always needs monitoring and coordination. And that's why the question for us was how to coordinate the whole activity. And in each province, we have provincial TB center, and the functions of this centers include coordination as well within a given province. And after we introduced the verification mechanisms to verify data on completed cases at the outpatient level, the question was like, who coordinates that, who does the verification and confirmation, and provincial TB centers played the key role here because they became the entities that coordinated and verified the whole activity, and they also worked with the primary care facilities. And we do understand that additional funding was required for the health system. And when we introduced capitation standards, well, it's not that big, but it was enough for provincial TB centers so they could perform all the functions mandated to them as part of the innovations we introduced back then. And here I would like to show you, here we have the rates for successful treatment at the outpatient level. And you see that if the drug susceptible TB case is completed successfully, then it's 12,000 soms. And if the drug resistant TB case management is successfully completed, then we pay 24,000 soms. And it's enough as we see it. And again, we were guided by the available budget capacity, so we could ensure that our personnel really could manage the cases. And also we allocate funds for transportation of biological materials. And here we put 2 in the last provinces, and it's like 500,000 soms overall. It's enough. And as for the objectives set before us in the future, so the fund has to develop the long-term TB financing policy based on TB program priorities, given the restructuring and optimization of the TB network, and the plan for transition to state financing for the interventions currently funded by the Global Fund. Redistribution of savings as a result of restructuring of the TB services system, and channeling funds to other important TB activities without adequate financing now, and improving financial techniques for new functions of the TB network and its entities like coordination, monitoring, TB laboratories, transportation of specimens, and support to information systems, and further development of all information systems which are required for us to provide financing of TB services. And that's it on my side. Thank you. Thank you so much. I'm sure your presentation will a lot of questions, and colleagues, if you have any questions, please, you can write them in the chat. We will try to respond. You know what? It seems to me this presentation shows an example of very competent support to reforms in a selected service, in a selected area. And so how the health insurance fund creates incentives as appropriate to support this policy area. For example, we do see that the overall vector of TB services reforms is like switching to outpatient treatment, and the fund creates incentives. So hospitals don't have extra incentives to keep mild forms of TB because there are specific coefficients, like factors, to regulate the behavior of and performance of TB hospitals. And given this, this is just demonstrated, it's clear, it's quite a competent approach. And at the same time, the health insurance fund is focusing on PHC level and promotes outpatient treatment of TB patients. The fund, having recognized that it's not possible to finance only TB hospitals as part of the TB service, and that's why other financing techniques were introduced. The fund starts operating at the provincial level. So provincial TB centers could work more on coordination by introducing special coefficients, and actually 1.6 soon it's per capita coefficient. If you multiply it by the population size, it accounts for a sizable amount of money, and provincial TB centers have this money, so they can carry out coordination function. And since there are serious problems and TB service associated with laboratory services, again, there are new approaches. And the fund, health insurance fund, has developed relevant approaches, and a lot of extensive work is in progress. And then another important area conducted by the fund is again related to information systems, and there is appropriate activity underway as well. And the fact that the fund has found the financing for transportation outsourcing for provinces, since now other provinces can be funded so far by the global fund, but gradually the fund is demonstrating the political will. So later on, they could continue the same activity. And it seems to me the operations of the health insurance fund in TB sector shows a very good example of how you can competently create financial incentives. My congratulations to the fund. Thank you very much for your presentation. Thank you, Ainura Sultanovna. Thank you, Clara Turgunbekovna. Let us continue our conference. And once again, I would like to thank our speakers for on time, because it's very important for us as facilitators, because during the days of our conference, so we could see that that was not always the case. And this is a very important area, and we have a lot of information materials, and all these materials are uploaded to the cloud. And dear colleagues, you can get back to them because a lot of detailed information has been provided, and many questions could be asked about that. And now, dear colleagues, we would like to show you a video, and this is not the new video, and it was not specifically for this conference. So it was prepared for the 20th anniversary of the health insurance fund. So it's like it's been developed. It was developed 4 years ago, and if you pay attention, you will see the younger version of Ainura Sultanovna. You will see Madamin Musaevich, but please be careful, Madamin Musaevich. Well, you need to find him. Can you imagine? It's 1996, 1997. You will have to recognize him, yes. And for the, unfortunately, we don't have the prize for that. And you will also recognize the other funds personnel. And some of them are here, some of them are colleagues that work with you and us in Kyrgyzstan. So colleagues, please, the video. This is the health insurance fund under the government of Kyrgyz Republic. And today the fund's abbreviation is well recognized by everyone, but we can recall that 20 years back, it was not really clear what will come out of this idea aimed to protect us against in the settings of the new democratic development of the country. Let's recall how important it was back then to us and how it all happened. In early 1990s, when Kyrgyz Republic became independent, the situation with the nation's economy was quite bad, which affected the health sector as well. And in this context, the budget financing went down, which resulted in the deterioration of the population's health. That necessitated the sector-specific reforms, primarily aimed to improve utilization of funds and improve the health protection system and improve the health services. An important area was to develop the new financing system and its introduction, including new financial sources and improved mechanisms for funds distribution. So, and Bismarck met in the Great Silk Road, and that was the quote from one of the WHO specialists, and that meant that state health insurance was to play an important role. And in 1992, the law on the social health insurance was adopted, laying the foundation for introduction of the health insurance in Kyrgyzstan. But due to bad economic situation until 1997, that issue was postponed, and over that period, the health financing levels went down even further, and access to health services worsened even more. And it became clear that we had to introduce new financing sources, and that's why the Nations Assembly decided to introduce mandatory health insurance starting 1997. The health insurance introduction process had to be managed by the Republican Health Office, which later in 1998 was transformed into the State Health Insurance Fund under the government of Kyrgyz Republic. And the social health insurance is the form of governance protection aimed to protect the citizens' health. So that provision is mentioned in all the documents, and the goal of the fund is to provide the insured citizens of Kyrgyz Republic with high quality prevention and treatment as part of the mandatory health insurance programs. And experts have noted the characteristics of that system: staged implementation in the whole country as part of the coordinated health reforms policy, the uniform conceptual approach at all levels of healthcare delivery and prevention, and the establishment of the jointly used shared information support systems of the Ministry of Health and the fund, integrated databases of the fund, and introducing new payment techniques and quality control, and collecting contributions to the fund via social mechanisms. And in late 1990s, when the health expenditure went down from 3.7% in 1991 to 1.9% in 1999 as GDP. So introduction of the new techniques back then made it possible to support the health sector and to prevent the collapse of the healthcare facilities. In 2001, the benefit program was developed, and it's the national social standard in health sector. And it defines the scope of health services provided free of charge or for the population, or the provisions for the privileged populations. And in parallel with the introduction of the benefits package, the co-payments were introduced for several health services to replace the informal payments, which were widely spread in the health sector, and some 60% of health expenditure was allocated on that, and the great increase of the sector's budget made it possible to expand the scope of health services and prevention services provided free of charge to the population as part of the benefit program starting 2006. In line with that program, health services to pregnant women and to pensioners to children under 5. So health services are provided free of charge to these populations, and starting 2008, pensioners aged 75 and older receive services free of charge. For the rest of the pensioners, the co-payment for hospital services was reduced to the minimum 200 and 260 sums. And to compensate for cancellation of co-payment, in 2006 to 2009, more than 600 million sums was channeled, and to introduce market governance mechanisms, the functions of the provider and the payer, the purchaser, were split. Legally, the functions of a single payer were in the laws for the fund, and in Kyrgyz Republic, that function was initiated to ensure fair distribution of funds. And accumulation of the budget funds nationally made it possible to ensure fair distribution of funds among health facilities, regardless of the economic status of a district or a city. And since its first days, the fund continues its policy to enhance primary health care by prioritizing its financing. And thanks to accumulation of health funds nationally, the fund managed not only to equalize the primary health care financing standards in all provinces, but also to increase the overall amount of financing from 23% of all funds in 1996 to 49% in 2009, and to provide more opportunities for healthcare delivery at the primary care level, to improve access to drugs for the insured population. Starting the year 2000, step by step, the country introduced additional drug supply program for the insured citizens at the primary level. And by 2003, additional program of the fund was introduced in a phased manner in the whole country. And now the insured people buy drugs based on prescriptions and pay only for part of the amount, and the rest is compensated by the fund. And the compensation rates for drugs account for some 50% on average, and annually to implement this program, 75 million sums is channeled, and in addition to for people with socially significant diseases as part of the state benefit program, 25 million programs is million sums is provided. And additional drug supply program in implementation made it possible not only to ensure that doctors not only focus on treatment, but this is also an example of partnership based on contractual relations between the public and private sectors, and broader engagement of private providers made it possible to expand the pharmacies network. And an important characteristic of the fund is not that the fund just pays for the services based on contracts, but it also monitors the quality of services and analyzes the effectiveness of resource utilization in the overall context of health reforms.
The fund annually carries out the appraisal of the quality. More than 60,000 cases of rendering the medical services on the in-hospital and outpatient basis. We can see the satisfaction of the patients through the questionnaires, which also try to get the feedback from the patients both from the paper format as well as from the hotlines. The hotlines basically accumulates information of complaints as well as the comments and recommendations from the patients. Every case is debriefed together with the health professionals that participated in the treatment of the patients and detection of the causes that resulted in violation of the rights of the patients. One of the clear examples that produced the positive results in implementation of the clinical practice of the standard schemes of treatment and monitoring is the sustainable reduction of operational interferences specific to the intestinal diseases, as well as the reduction of the hospitalization of the patients with the bronchial asthma. The work with the patients and the population is based on the new approach, so that it's from the passive channeling information to the partnership-based exchange of views. And we're setting the new priorities in the society, as well as in the specific groups of the communities and every individual. In this activity, the fund of the mandatory medical insurance is based on the respect of the rights of the patients, based on the needs of the patients. The recognition of the effectiveness of the system, that the system has to serve the people, and it assumes the respect of human dignity. According to the law on the structure of the government of the Kyrgyz Republic of October 22 of 2009, as well as being guided by the articles of 742 of the Constitution of the Kyrgyz Republic, the fund within the Ministry of Health has been transformed into the fund of the obligatory or mandatory medical insurance. This measure allowed to increase the efficiency of the use of the funds of the state budget, which is appropriate to financing the state programs of guarantees, so that the funds are now considered the funds for the social protection, to protect the rights of the citizens in the area of health, based on the insurance schemes of financing and basic state medical insurance. It also allowed to include the implementation of program of guarantees at the private companies, and to enhance the competition among the suppliers of the health services. It gives a good choice for the patients. We expect that the engagement of the private suppliers to the implementation of the state guarantee program should lead to the reduction of the financial burden to the state system of health. The history of the fund of the obligatory medical insurance in Kyrgyz Republic is continued. It means that there will be new victories and attainments.
Уважаемые коллеги, мы продолжаем нашу конференцию.
Dear colleagues, we're continuing our conference, and I would like to thank the authors of the footage. The author is Ms. Bailinova, and she is well known in Kyrgyzstan. She used to manage the press center of the Ministry of Health. So with the support of Mr. Murat Uzakovich, you remember him very well, he is the soldier of Invisible Front, and right after Ainura, he used to travel throughout the country and used to make the footage. I would like to thank all of them. Unfortunately, they're not today with us within the conference. But this is the history already. And to the date, we're speaking about the current situation and about the future, how to build our anti-TB or TB control service. Distinguished colleagues, in our chat, we have certain questions, and we do have some time to answer to a couple of questions. As for the others, we'll remove them, we'll move them to the relevant sessions where there will be relevant information rendered by the contributors. So the first question, I believe that Clara is going to answer this question. So whatever services are included into the TB control, can we know about the asset base of the fund? Mrs. Clara answered to this question. And the second question, whether we can know about the phases of introduction of the electronic patient cards in the TB control or TB service institutions. And as for the outpatient service, so Ms. Ainura probably will speak about the second question. Please, Ms. Clara, for the first question about the fund. Okay, thank you very much for your question. Well, as you may know, the major mission of the function of the primary care is the detection of the TB cases. So when we have been introducing the principle of the family-based medicine, we have taken as a basis that the health professional work directly with every patient. Therefore, at the level of every facility, we have the special points on the collection of the sample materials, and will be, if you remember, we have been speaking that we're also carrying out the transportation of the biomaterial, and the lab equipment, the gene experts are well equipped, not everywhere, but they are mainly at the oblast level. So therefore, the issue of the transportation becomes quite important. And then this is the patient management issue, starting from the obtaining the results of the test, as well as registration of the patient and the further management. So in my presentation, I mentioned that we have the case management concept. The case management concept includes all actions of the health professionals regarding the patients with the TB on the treatment of such, diagnosis, prescription of the drugs, the monitoring of the state of the patient, all records, engaging the relevant non-government institutions that can render any type of social assistance, psychological support. This is definitely in line with the supply of the relevant line of drugs. So these are all the functions that are included into the system. I have also referred to 12 medical studies which are obligatory for the patient, and organizations are supposed to pay for this. So in case this very lab tests cannot be carried out within the center, then we have developed a mechanism so that the center can enter into the agreement with a private lab, so that we have set the basic regulatory financing, and these services can be covered and paid to the private labs. But as for the TB patient, based on the state guarantees program, all the services are done for free of charge. As for the asset base, as I have mentioned, unfortunately, not all laboratory tests can be carried out in every center of the family medicine. So therefore, the gene experts also not available in every region, in every district, I'm sorry, but in case they don't have the gene experts, in this case, this is available at the oblast level or in the relevant hospital. Well, additional information, Mr. Madamin Musaevich, please. Yes, it is true, the asset base in the district TB hospital is not at the great level, and Mrs. Clara has already mentioned about this. As you know, we have in 37 centers of the family medicine or family health points, we have the X-ray equipment, and many of them is already obsolete, not operating, or frequently breaking. In 24 districts, we have more or less well operating X-ray machines in order to detect the cases. But within the framework of the upcoming programs and the grant financing from the Global Fund, 24 districts additionally will get the equipment, will improve their asset base so that we can carry out the timely diagnosis. As for the labs I have already mentioned, the director of the OSHA Center of the TB Control is here, and in order to provide the accessibility and the accelerated supply of the materials, it will be supplied to the southern laboratories. The test will be carried out. Thank you very much, Mr. Mladen Musayevich. And another interesting question related to the electronic medical patient card, how it is going in the TB service right now. Ms. Ainur, please. Yes, thank you. And I'd like to thank you for your question. Well, actually, on the second day of the conference, there was a presentation about the perspectives of development of medical informational systems or health informational systems in the Kyrgyz Republic, where we have provided detailed information about the health informational systems we are developing in Kyrgyzstan. But let me provide very brief information about the electronic medical card. Of course, this is the software product, which is the part of the TB informational system, and it closely interacts with all other software programs which are currently developed and which are implemented in the country. Electronic medical card has been developed for the TB hospitals. It's also developed in a way that it can be used in any outpatient facility. And today we know that this very software product, to a great extent, is successfully implemented in all hospitals. As for the phases of implementation, development of the software, it was developed by the USAID project, Will Win the TB, in 2017, and practically it took about a year, basically, and they were testing this very software. So in this light, I would like to mention that we have absolutely a great facility. It's a Republican or anti-TB facility located in Karabalta, and it was a kind of an area where we have been testing all different approaches in terms of development of informational products. And practically all of them became the pilot for us, where we have been developing this informational product, because it's impossible to develop a good software product without clear interaction with the software designers. And of course, about who will be using it. That's another important question. In 2017, we have developed it. In 2018, we have started phase-based implementation. So currently throughout the entire country, in all 24 hospitals outlined in the roadmap, they will continue introducing this very software in coop with other software products. Thank you. Thank you very much, Ms. Ainur Sultanova. Distinguished colleagues, there are a lot of questions in the chat, but unfortunately, we as moderators probably will abuse our time to regulate the process of questions and answers. Of course, we'll do our best to answer the question. We'll systemize them, and the process of presentations in the process of other sessions will definitely provide you information, and most probably we'll cover all these questions. Please stay with us, and this basically motivates us for active discussion. But we are approaching the first break, and we are not really strongly violating our agenda. We have 20 minutes for break, I would like to request the operators to show us the entire room or the hall so that you can see to what extent the Kyrgyz party has well prepared for our today's virtual session. And I would like to say that along with the central institutions such as the Ministry of Health, the fund, the project, we have also the presence of the heads of the health departments from different regions of our republic, as well as the heads not only of the health facilities, but also the heads of territorial departments of the fund from different regions, from different oblasts. They specifically arrived to this very capital to participate in our conference. So therefore, distinguished colleagues, should you have any questions to the implementing agencies, definitely will engage them into our discussion so that they will also actively providing the answers. But I believe that after lunch, we'll have a more open discussion. The first half, of course, of the day will be mainly covering the presentations. Now, distinguished colleagues, we're approaching the first break. So in 20 minutes, we'll resume our conference. And there is a little announcement. We'll have two presentations. These presentations are as interesting as the previous ones. They're not that strategic. They are more practical, like how it has been done, how it can be done. And I believe that therefore they are really interesting. So please stay with us. I see that after the break, there will be even bigger number of participants to get closer to our practice with our virtual presentations. So distinguished colleagues, 20 minutes break. Thank you.
Раз, два.
Уважаемые коллеги, мы продолжаем нашу
Dear
работу.
colleagues, we'd like to continue our work. So attention, please, in the hall and online. So we are waiting for our participants to join us. And before we switch to our next presentations, I would like to give the floor to Eric Reading, and we could see wants to comment. And dear colleagues, technical support, please connect.
Алло. Уважаемые коллеги, тут идет
Dear
параллельная
colleagues,
встреча
so we are
с
having
представителями
parallel
Минздрава
meeting
Таджикистана.
with
И Эрик с
representatives of
минуты
the
на минуту
Ministry
подключится.
of Health of Tajikistan, and Eric will join us any minute. Okay, let us continue, and you will inform us. Maybe we can give him the floor. And who else raised their hands? 4 participants. Colleagues, I suggest we give the floor to Anna Tsipke. So she has a number of questions, and I guess her questions will be asked now, and then we will answer them during the presentation. So Anna, please. Hello, dear conference participants. Allow me to thank you for this excellent opportunity to hear about your successes and the fundamental reforms implemented in your countries. So I'm the director of Nur Sultan City TB Center, and half of TB practitioners in our republic and our service. I would like to extend our deepest gratitude for your examples and successes, which are applicable to us, and we can implement them as well. And you know that now we have serious reforms in progress in health financing, and we have a lot of discussions, approaches. And as for your conference, we could hear a lot of points we will discuss as well. With regards to our country, this is especially relevant to the information presented today about health financing reforms. And my question is, so you've been implementing that for several years, step by step, and we are pleased to know that your reform was phased, and each new tool was pilot tested, and that's visible. So it was very careful, gradual approach, and definitely it yielded its results. And in this context, I would like to ask you a question. Do you see any indicators showing improvement of outpatient services as a result of your financing reforms? Do you see any advancements, any progress that could suggest effectiveness of the ongoing reforms? I mean, your indicators for the outpatient level and overall effectiveness of the activities. So if the operations became more effective as a result of the ongoing reforms in your country. Thank you, Anna, for your comment and for the question. So on top of the question of yours, we keep in mind your previous questions, so we will definitely answer them. So the PHC effectiveness and relevant indicators, I guess we will give you answers later on, but before we give you the answers first, we will need to present more PHC level activities because we haven't reached that point yet to give you the answer. And if you don't mind, we will get back to those issues when we present to you the primary care level and what activities we are implementing there. Thank you so much. Thank you for participating in the chat and in discussions. Dear colleagues, can you please say who raised their hand. So we have a question from Svetlana Pak. Questions from Svetlana Pak. So since you expanded the outpatient model, if the TB service role has changed, if yes, then how? And the reduction of the bed pool in TB facilities, has it resulted in laying off personnel from those facilities? Well, I guess let's postpone the answer because now we will have the presentation on restructuring TB service and introduction of TB service financing, and there will be slides providing further detail on that, and we will also show you the video equally good as the previous one. So the video which will show you details of a selected health facility. And if you don't mind, and if Eric hasn't joined us yet, so if he hasn't, so colleagues, please check if Eric is with us and if he can switch on his mic. And if not, then we will continue our activities, and let me give the floor to head of department. Head of the budget department, Gulmira Borchubaeva. So actually, she's been part of the reform since 1997. I guess you could see her in the video. So Gulmira back then only started her work, and she got relevant education, and throughout the reform process she's been in the middle of that. And Gulmira Barchubaeva, currently she's the head of one of the biggest departments of the mandatory health insurance fund, and we can say she's responsible for the most important activities of the fund. Gulmira, the floor is yours. Hello, dear conference participants of the international conference. Allow me to present to you financing of TB services via strategic purchasing in Kyrgyz Republic. Currently, based on contracts with the Mandatory Health Insurance Fund, there are some 179 health facilities, and of course, definitely this year, the structure of the health sector was optimized. The Ministry of Health decided on that, and there were like mergers, and now 11 family medicine centers, 61 general practice centers, 30 hospitals, 2 emergency care stations, 11 dentistry polyclinics, 9 specialized health facilities, 22 TB facilities, 31 private hemodialysis center, and 2 public health facilities work with us only following the basic health insurance program. So all these entities are working with us, and of course here I would like to focus on TB facilities. So, and the structure of TB services is well represented in all provinces. So in the city of Bishkek, we have 4 health facilities providing TB care to the population. In Chui province, we have 3, in Osh 5, in Batken 2, in Jalalabad 3, and in Isikul 3, in Narin 1, and in Talas again 1 health facility. So this slide shows in general the amount of budget with the fund as shown in US dollars, so you could get the picture of the scope of financing administered by the Mandatory Health Insurance Fund. And so the consolidated budget as of end of 2020 was $212 million, and 4% of them was to finance the TB service. So it is 8.8 million USD for TB services. And more specifically, TB facilities have two sources of financing. One is some 95% is the budget coming from the mandatory health insurance fund, and 5% is earmarked funds. Oh no, it is special funds earned by health facilities themselves. And for the health insurance fund, an important objective is to ensure effective implementation of TB service financing. So primary health care hospitals aim to improve the quality of TB services and to reach the health policy objectives. And of course, the mandatory health insurance fund has the following important objectives, like to develop the TB service financing strategy, aim to ensure financial incentives to support the policies against TB, to improve coordination of operations by the Ministry of Health and the fund in terms of restructuring the TB system, planning and redistribution of savings. Another objective is to improve the financing techniques by revising on a regular basis of disease-related groups, DRGs, and of course on that the equitable payments depend. To improve the payment for PHC services, introducing incentives to improve the quality and outcomes of TB services. And ahead of us also an objective to develop the mechanism to procure TB drugs, consumables for TB laboratories from the state budget, and to develop financing techniques for new TB networks functions and its units, to develop and implement information systems for TB service financing. A case treated in TB hospitals. Of course, the mandatory health insurance fund started its financing since 2012, and they joined our system with their own financing. As mentioned before, previously the TB service was funded based on expenditure items, so it was like residual financing, and definitely by the time they were transferred to the funds-based financing system, the service was quite awkward, consisting of some 30 health facilities, and it was not fully optimized. They're heavily indebted, and the fund definitely had to do the following. I mean, before we fully switch them to new financing techniques, we had to do a lot to find the financing to cover the debt, and then to do the restructuring and optimization, as mentioned by Clara Turgunbekovna in her presentation. Of course, by negotiations, as a result, we optimized the system. That was stage one, and hopefully the Ministry of Health will not stop and will continue further optimization of the service, and know that the fund finances hospital services using case-based payments. And this slide shows that the amount from the fund per case is calculated using this formula. There is no human factor. We are not guessing, we are not giving funds just for the sake of giving funds, and we also make analysis of treated cases and each individual case treated. So the amount of reimbursement follows the established formulas, and of course an important role here is played of the base standard rate per case treated, and also we have factors for privileged populations. So each case is treated individually because the amounts differ. It depends on the DRGs and of course the adjustment factors. So we have geographical factors, we have the factors for small towns and mountainous areas. And of course, it all affects the final amount per case treated. So in Clara's presentation, it was mentioned that before switching to the single payer system in the DRG system, we only had 2 DRGs and 2 factors. Very simple system back then, but anyways, with the support from USAID and WHO, the mandatory health insurance fund could revise and recalculate the coefficients and introduce 10 DRGs, depending on which so factors could be specified for treated cases, and DRGs are playing a very important role here. And of course, the basis, the reason for financing is availability of contracts with health facilities, and it's important for the fund. And of course, our contracts fully detail the terms, conditions, scope of financing, and we are negotiating with health facilities, so our local offices define the scope of services, and in line with the contracts we sign, specifically, we indicate rights and responsibilities of the parties, the fund, and our health facilities. So the cost per treated case. The slide shows that in 2020, per case treated without DRGs, the cost per treated case was $548, and it's not bad. It goes to finance TB hospital services, and of course, this is due to the fact that patients receiving hospital treatment, they have long hospital stays, and in line with clinical protocols, it's like more than 60 days, and the amount to be paid is $548. This is based on the 2020 budget, and of course, as for the reduction, I can tell you that the dollar exchange rate is quite high, and then as for Zooms, well, the rate is not going down in TB service, thanks to the fact that the rate is going down. So the amount of financing for TB sector is not going down. And this is direct expenditure per patient. We are tracking this as well. And for financial experts, this is also an indicator. So each TB health facility tracks such indicators based on costs per bed day, so drugs and food. And of course, based on that, we can identify how the health facility is managed and how TB health facility managers, how they manage their health facilities, how they redistribute the budgets. They have some autonomy, and they can prioritize based on their needs, and definitely they execute budgets themselves, and they are responsible for completeness and the appropriateness of budget execution at their respective levels, and the treated case at the PHC level. Of course, for us, it was important. We started with pilots in 2017, and of course, after our government approved the provisions where the health insurance fund was allowed to channel all the funds
to optimize all the TB services so it can be reallocated for the outpatient services related to the treatment of the TB. And of course, we had a task how we can do this in the level of the primary care, and with the support of the project of USAID to eliminate TB, we have developed the software, and Ainur has provided very detailed information about this. And thanks to this very software product on the TB treated cases, we can gain the information about the organization, information about the patient, as well as to define the case, the type of the case, whether it's a sensitive or whether resistant, and the outcome of the treatment, information about the team that was managing the case of the TB. And according to this very software product, we can see the results of verification, and we can verify by ourselves, our territorial entities in charge of this. And in this product, we have the authorization, and of course, the fund of health insurance will get the final product, which is the report and the confirmation of the payment. And we're trying to carry out it on a timely manner so that we can motivate the experts and the team at the primary care so that they made the efforts and will work in a better way in this very area. Distribution of the motivational or incentives related payments in dollar terms, you can see $145 is paid for the treatment of TB case for the sensitive TB, susceptible TB, and about $290 for the resistant form of the TB. And as you can see, the distribution. Now we distribute these very funds between the team members that were managing the TB case and the outpatient level, where the head of the organization gets 1% from every treated case, the deputy head 1%, district TB doctor 10% from the every case, the nurse of the TB control office 7% from this very amount, clinical head about of the family doctors 3%, and the senior nurse 3%, the family doctor 20%, and family nurse gets about 55% from the every treated case, which is paid by the obligatory health insurance fund. You can see the dynamics starting from 2017. In 2017, we had pilots only for the fourth quarter. The results were not bad. Annually, the obligatory health insurance fund for financing the treated cases at the outpatient level reserves about $300,000. The amount is not that small, actually, and as a result of 2020, in our organization, they have earned $406,000, and the obligatory insurance fund has totally covered all these services. And here you can see how many cases have been treated of the susceptible TB, how many cases of resistant TB has been treated by year. And of course, the fund of the obligatory medical insurance is not stopping at this. We're trying to enhance the pilot. And of course, at the same time, it requires funds, the fund of obligatory health insurance funding. in the formation of the budget for 2022 already embed the increasement of the budget for the payments of the treated cases at the outpatient level. And in this area, of course, we are to do serious work. The payment of the lab services, of course, on this slide, you can see what was before and what is now, what has changed, if in the past, in our organizations of health, where we have prescribed our patients that were in the treatment at the primary care, and not every agency was able to provide all the range of the services that were needed for the diagnosis and to identify the outcomes of the treatment. So our patients had to refer to private labs, and as such, they were supposed to pay from their own pockets. But with the support, again, with the project, the fund of the obligatory health insurance took a decision, yes, we allow our organizations, health organizations, within a range of the budget that we allocate for them, which is basically includes the possible increasement, they are entitled and authorized to enter into agreement with the private labs and to pay those services that they cannot perform by themselves. I mean, the laboratories, in terms of the tests. So they are authorized to pay for such services through the contracts with the private labs. It's quite significant in terms of helping to our patients because it helps to protect the population from the TB, and it's directly related to the treatment. So everything related to TB should be free of charge. So here you can see that we enter into agreements. The health organizations that do not have and that cannot provide this type of lab services and tests. So they have identified the list of the lab tests for the patients that they can perform themselves and they can outsource, and we have the basic pricing for the tests performed by the private labs. Of course, the private labs cannot charge the full-fledged rates for this, so therefore we have all the basic rates which are acceptable for the private labs. At the same time, it's not that costly for our budget. As for the transportation of the biomaterials, we have also carried out the pilot project. It works as a system in Akchui and in Talas regions. And Mr. Marat has already provided deep information on this. And of course, this activity will also include about $6,000 per annum. And currently we're working with 2 regions right now, and practically these funds are well enough. So this system works well, and it has justified itself, and the funds of the obligatory health insurance will work on this. And of course, we're thinking how we're going to cover the other regions, and I'm confident that it will happen. As for the principles of the payments for the transportation, we have been using the outsourcing methodology. We have the service of a special communication, and it provides these various services. So these contacts are in line with the health institutions. They enter into contracts, and these funds envisaged in the budgets of the regional TB control centers, and having received these funds, they control the payments, and they basically manage their costs with this very company, given company, I mean private company. As Ms. Clara has mentioned, we have tested logistics and the safety and secure transportation, so that the payment for the transportation costs, the transportation company performs the transportation of biomaterial based on the weight, like kilograms. And the tariffs are well outlined in the contract. Here you can see the report for the first 6 months. And as you can see, the number of the sputum samples delivered for the tests. And you can see the number of the anti-TB drugs that have been supplied through this very mechanism. And the fund of the obligatory health insurance has paid about $3.5 thousand for the first 6 months for these transportation services. Of course, we have no time to relax because there are more tasks and objectives that we're targeted to in terms of the transportation of the biomaterials and the drugs, and in overall in other areas too. So we're trying to introduce the payments for the successful completion of the TB case in other regions. So we're trying to introduce the mechanism of verification for the successful treatment of the TB in the level of the primary care. And we're planning to improve the payments for the lab services, phase-based implementation of the transportation of the biomaterials and anti-TB drugs to other regions of the districts of the region. And we're also planning to develop a mechanism of access of the patients with the TB to drugs as well as to deal with the undesired consequences of such treatment. As for the financing, we closely interact with the regional anti-TB centers, and of course we're trying to raise their professionalism. And of course we need to improve the informational systems initiated by the fund that will support the new methods of financing for the TB services support. That's all I want to share with you. Should you have any other questions, I'll be more than happy to try to answer them. Thank you very much, Gulmira. I'm confident there will be a lot of questions, and we'll get back to them. And I will give you the floor at a later stage again. To the question of Ms. Anna Tsepke on the lab services, there will be specific presentation of Gulmira covered all these issues. As for the transportation services, how it's rendered, how we're arranging the outsourcing in case such services are not available within the organization. And in addition to that, to the question whether DRG is included or not, of course, there are specific budgets. The next question from Nur Sultan is another very interesting, like computer tomography. Unfortunately, computer tomography and resonance tomography is quite expensive. Right now, it's not covered by the funds, but probably it will be included because the government has purchased required number of the computer tomographers, which are set in the regions, oblasts. So I believe that the process of new calculations will be in progress. And as for the outpatient treatment, of course, will recoup these very costs. As for the question of Ms. Svetlana Pak, she was asking about in relation to the enhancement of the outpatient treatment, whether the role of the anti-TB has changed, specifically the oblast-based anti-TB services and the national centers. As you can see from the presentation, their role has significantly changed, and they're shifting from the function to executors to the function of coordinator to the function of the organization, which is enhancing its authority to interact with the primary care and with other institutions and hospitals. As for the reduction of the bed pool, of course, that's quite a painful issue, but this process, anyway, we have to go through. And reduction of the hospitals and the bed pools, well, cannot be maintained by the fund in the way it operates. So therefore, we see the certain type of restructuring or optimization. Another interesting question, I believe that all of you are interested in this, especially representatives of the primary care. There was a slide of Gulmira where she was demonstrating the proportion like who gets how much percentage from the payment that the fund pays to the primary care. And I noticed that the representatives of the Naryn Oblast started to take photos, like who is supposed to get how much. And it indicates what percentage goes to the director, deputy director, senior nurse, and so on. But the family doctor and the family nurse, as you have noticed, they get the major stake of this very budget. And the question why? Why the family nurse and the family doctor? Because this process was the subject of vivid discussions. It was the pilot calculation, and after some period of time of discussion in the process, when the money started to flow, when they reached the hands of the doctors and nurses and the directors. So this picture has basically well worked out. So after 2 or 3 years of this type of testing, this is the way it looks like now. So even today's picture, I mean, in terms of the proportion of the percentages, it's not, this process is kind of live. Tomorrow situation may change, the motivation and incentives also will change, so that it's kind of an open document to discuss. So, colleagues, I believe that we're not going to dwell into answers in details. Let's go to the next presentation, and then we'll go to some other questions, and we'll get back to the Q&A session. Okay, thank you very much, Mr. Marat. Moreover, in the chat, we see active participation of our experts. So we don't have enough time, and the experts will do their best to cover the questions raised. There are many questions. And of course, we'll try to voice it out, but some of the questions will be covered in the chat so that our experts will give the answers to them in writing. Okay, the next presentation. The next presentation will cover one very important aspect of quality management. Quality management is a very, very important and big issue. And there are many areas that are related to that. But inside of this very area, it's really important to remember to develop and to identify the verification of the TB cases, because the obligatory health insurance fund cannot just put this issue on its gravity. So how it has been promoted and what we have right now in our hands will be voiced by Umurzakova Nurgul. Nurgul Timurzakova until recently was working as a head of the department of the strategy of planning and quality of medical assistance in the fund until recently. Nurgul, and recently she moved to the international organization, and she acts here as an international expert because the process of transfer of specific knowledge is still in progress. Please, Nurgul, floor goes to you. Well, Nurgul is getting connected right now. Thank you very much, Ms. Ainur Sultanova. Good afternoon, distinguished participants of our international conference. As it has been noted, today I'm going to present only one area on quality management. That's the verification of the treated cases of TB by the Fund of Obligatory Insurance. The fund pays the payment to the primary care, and there is one issue about the verification of these very cases. And today's structure of my presentation will be based on these very items, so I will try to cover the evolution of this very process and all our further steps that we have taken in this regard in the system of verification. Well, first of all, once again, I would like to remind that in our country, as for the primary care, we have introduced a new approach on the TB case management at the level of primary care. In overall, This is the entire set of activities to organize the case management of every case, every individual case of TB, starting from the setting diagnosis of its completion of treatment. And it's based on the patient-targeted approach or patient-centered approach, which includes, besides all clinical aspects, it includes the social and psychological support of the patient. The objective of the TB case management is to improve the result and outcomes of the treatment of every individual case, and of course to reduce the risk of possible transmission. So we have developed the instruments on the clinical support of the patient.
Monitoring of adverse events, then treatment adherence, analysis, and tools for psychological and social support to such patients. So, as mentioned by previous speakers, since November 2017 in pilot districts, the payment system for successful completion of TB treatment at the PHC level was introduced, and its objective is to introduce financial incentives for PHC to improve the quality of each TB case management and to obtain positive results. The payment system looks as follows. So at the primary healthcare level, the patient is registered. The patient who starts treatment at PHC level, and then when the treatment is finished, an electronic notification is sent to the local funds office. And we have to highlight the fact that since the early months of the system implementation, the software was developed and notifications were electronic almost since the very beginning, and provincial TB centers participated in identifying outcomes of the RTB treatment, and local fund officers verified cases and submitted claims for payments to the central office of the fund, and the central office of the fund channeled the funds to the PHC level. So that's how the system worked in its first months. And now I would like to focus on the verification process, which is highlighted in green here, in green line. And so in 2019, the fund's order approved the procedures for verification of notifications about successful TB treatment at PHC level. So their goal was to identify validity, so to verify such cases, and their objectives suggest that actually the information should be provided in the case file, and the objective is that at the PHC level, there should be the confirmation that the TB case is reported, then correct identification of the TB form, susceptible or resistant because it's different money, and then the outcome of the treatment should be correctly determined. So I would like to highlight the fact that the fund pays for two outcomes: treatment completed and cured. Next, please. So in 2019, the fund for the first time started verification at its local offices, and we have to know that there were such cases. So the data that TB registration data matched only in 89%. The rest of the cases do not mean they were not managed at the PHC level, but there were differences in registration numbers and the electronic notification and the outpatient card of the patient. Not all patients were registered in the logbook. The second objective is to identify if TB was susceptible or resistant, In 98.5% of cases, all data matched with reporting forms of TB patients. However, we need to mention there was inadequately managed medical documentation. And when filling out medical documents, there was no verification of data across all reporting forms. So there were differences in data. And in paper-based TB01 form, outpatient card of the patient, they were not always test results were indicated. And objective 3 is identifying treatment outcomes based on treatment success criteria. So here, not always the sampling timelines were observed for chemotherapy control purposes, microscopy, and as for TB01 form, the outpatient cards, culture controls were not always indicated at the initial stage of treatment. And for the fund, it turned out to be a very labor-intensive process. First of all, the fund has its quality control activities twice a year, so once every 6 months. And to conduct 100% verification of all cases submitted for payment, it was challenging for the fund because of only 40 persons working in local offices, so lack of human resources, and the scope of cases to be verified. Well, the caseload was very high. And the second point, for an in-depth and full-fledged verification, the fund needed more knowledge of TB management. So the fund had to become a TB expert. And this slide, well, I would like to show you the results of the intermediate survey with regards to the system implementation, and we were guided by data for 2018 cohort, and the survey results match the verification of the fund. So as for TB case registration, in 96.3%, the data matched. So patients were reported in all approved logbooks. And again, the registration number not always coincided with that of in forms. And again, attention was also paid to timeliness and correctness of following diagnostic algorithms at the PHC level. So, and again, in 90% of cases, all 30% of cases, all data were reported. So, for example, in DSTB patients prior to therapy, microscopy results were missing, gene expert culture results were missing, and outpatient cards of patients. And again, with DSTB forms, the X-ray data were not reported in outpatient cards. And likewise, data were mismatching in paper-based forms and laboratory logbooks and in electronic notifications. As for treatment outcomes against the treatment completion criteria, 91% it was correct. But here we can also highlight that control test results were not always indicated in outpatient cards. And the overall conclusion is that when filling out documents, data are not verified in TB01, TB02 forms. And again, there is inadequate quality for management of all approved TB forms. And based on these two verifications, we can say that a conclusion was drawn that these three objectives mentioned above were not enough. So we had to add two more, like adherence to TB treatment regimens at PHC level and timeliness of control laboratory tests. And the next one, please. And of course, we had to elevate to the new level the operations of provincial TB centers, which have to play the key role in verification of treated cases at PHC level. And this slide shows the present day operations of the verification system. So at the PHC level, it should aim to improve the data quality, ensuring TB treatment adherence at PHC level and timeliness of laboratory tests for control purposes. In parallel, we continue to improve the information systems, which were key for the fund to ensure a transparent and reliable financing data, and the algorithm for notifications and changed and for submitting documents for claims. So we integrated the electronic outpatient cards, the TB 01, TB 02, and the data from these cards were entered to the electronic TB register. And as for submitting notifications about successful treatment completion, so now we are retrieving this data from the electronic TB register, which contains complete information on a TB patient from the start of the registration till the very end. And notifications from the electronic TB register go to the database, so the funds database, as we call it. It's titled the treated TB case at the PHC level, and also we have a big information system on laboratory data, LMIS. And I have to note that we worked to automate all reports submitted for reimbursement, and now we visualized all statistical reports, which makes it possible to analyze them at a different level. So I'm referring to dashboards, which are used for analysis. And of course, the level of provincial TB centers mentioned above has changed to a new level because they are the key ones responsible for verification of treated cases, and naturally they coordinate all the activities related to PHC-based TB case management. And in that regard, the provisions for provincial TB centers were revised, as well as provisions for TB Consilium. If previously at provincial TB centers, TB Consilium was conducted for drug-resistant forms of TB, then now, so far, identifying treatment completed both for DS and DRA TB cases is done at TB Consilium sessions. And given the above, there was the need to change the order prikaz, and we revised the provisions for payments of successfully treated TB cases, and we redistributed the percentages mentioned previously, and we revised the functions of main entities participating in implementation of these provisions. And so far, this very electronic system for verification looks as follows. So at the PHC level, we register and treat patients, and such data are submitted to the provincial TB center. The provincial TB center verifies all outcomes, treatment adherence, and so on, and then it submits the verified notifications to the fund. The local fund officers verify it and submit the claim for payment upwards to the central level. And here we can see the new functions of the PHC. It's like managing and monitoring TB cases given the new approach. So PHC is responsible for timely entering data for the electronic TB register and registering all cases of TB and then submitting to Consilium all TB cases with outcomes cured and treatment completed, analyze all data, and of course to interact with provincial TB centers and local funds offices. Next. So here we can see the new role and functions of provincial TB centers. It's implementation and coordination of electronic TB register, verification of all TB cases registered at the primary healthcare level, monitoring and analysis of all these cases, control over correctness of TB case identification, then assessing correctness of TB treatment outcomes and interacting with the PHC with regards to quality and completeness of data. Next is the role and functions of local funds offices, coordination of data collection processes, authorization of all notifications, and timely submission to the central office of the fund, the reports for payments, and then the support to software, then interaction with the provincial centers with regards to verification and authorization of notifications and assessment of the TB service quality in line with their provisions and functions. And this is the role of the fund central office, coordination and development of payment rules for successfully completed TB cases, then calculations for each case and payments for each successfully completed case. And just the final slide, our next steps, we plan to expand the PHC-based TB case management and verification of completed TB cases to other provinces and areas and improving quality of data in medical documentation and information systems included. So build the capacity of provincial TB centers, PHC and the fund, and possibly now we are working to make sure that for the provincial TB centers, the module could be developed to streamline verification of successfully treated cases. So this is the end of my presentation. Thank you very much, and I'm ready to answer your questions, if any. Thank you, Norgol, for your very detailed presentation. A lot of information was provided. By the way, the role of TB service, the role of the mandatory health insurance fund, the role of primary health care. So those roles were shown, and actually you are active in the chat. So send your questions to the chat, and after lunch, we will answer all these questions. So now I would like to switch to a very interesting point. We will have a virtual tour of one of the hospitals. So it's a very interesting hospital. And by the way, the head of this hospital is with us, Zamira Rashidovna. So it took us long to convince her. So she's so modest and she was opposed to that idea, but we managed to overcome this and we will see her here. And so after lunch, she will answer your questions. So like how it is done on site in reality and what's going on with the hospital. So this is our video titled like this. So I would like to thank Yulia Berzinski, and she suggested that title, and it's very matching the spirit of our country. It's revolution of financing. So please, the video.
Earlier, we have been financed by the Ministry of Health. And we had the breakdown indicating the indicating the amount and the budget based on that. And so we were just executors. We have been performing what we have been requested to. And we, as managers, are remaining the same from the professionals in our agency. Of course, the bed pool basically is being reduced. Now it's only history. 100 bed hospital Karabalta, it's a history now. This is the way it was before. Everything has changed in 2012 when the hospital switched to the financing based on the unified PE. According to the law of the Republic of Kyrgyzstan on the system of payment, it's a consolidation of the financial resources of health with a view of further carrying out one-channel financing based on the calculation for the health and pharmaceutical services rendered to the population by the health institutions. In the formation of the budget, in the hospitals, we use the regulation like the average cost of the treated case. The administrator of the system in Kyrgyzstan is the fund of the obligatory medical insurance fund. When we're entering into agreement with the fund, we say that we have this number of patients to treat, and in case we'll not perform the agreement with the fund, then of course we cannot receive this money. But if we work in the way it is prescribed by the contract, then we get a very good remuneration. We have good funds, we have good funding, and today the hospital starts to work in a new way. All our activities are patient-centered. If they want, they come and they get the treatment, or they can get additional treatment. So starting 2012, step by step, the Karabakh hospital was going to its current state in order to assess the effect of the synthesis of new financing. We were allowed to have a tour in the hospital while we are providing the rights of the patients for the demonstration of their cases. So therefore, you may not see the face of the patient. Okay, these other patients are here. We familiarize ourselves with the documentation, with the requirements, and with the rules. So we familiarize the patients how they are supposed to behave in the hospital. We also take the thermometrical, biometrical data, the blood pressure, oxygen saturation, and we then fill the electronic card. And we maintain this type of electronic patient card for every patient. And it's linked online with the fund. And in case we type the taxpayer code, you will get the information about the patients, what type of treatment they're getting. And after that, we organize and send the patient to the relevant department of our hospital. By filling this type of electronic patient card, it is introduced into the system, filled throughout the entire system of treatment, and the card is transformed from clinical to statistical form, which comes to the fund of medical insurance. On the basis of that, considering the complexity of the treatment, we form the cost, and then the fund, in the relevant way, will cover this very cost. Electronic system is developed and introduced with the technical support of the USAID, unites clinics, laboratory activity, supply of drugs, and managers. So that's why from time to time, we'll get back to this very card. Let's continue our tour. This is the ward where the patients are transported. We had a very old, bad elevator, which was not operating. We have done the capital refurbishment. We have put the good lighting, as well as the alarm signals, a new elevator, and there is a good carts that we can transport the patients. Considering the intra-hospital safety control, we also have improved the ventilation system. Then we can see the wards for the newly arrived patients. And the wards are basically for the ones who are on treatment. We also have identification symbols. Yellow one means that the patient here also suffers for the sugar diabetes. So one knows that here you have the patient with a specific diet. If it's a patient with the sugar diabetes, and they have the specific food, nutrition, as well as the specific type of cleaning, so that the nurses will know that the patient with the specific disease. All the wards in the hospital are standardly equipped, convenient beds, closets, place to take food, and with the similar bacteriological test results, patients are located in the same wards. So there is no any kind of a high concentration points, and some of the wards can accommodate only one person. In hospital, control also assumes good ventilation. Ventilation is both natural and mechanical. In order to track the airflow, we have this type of test control length belts. So when we open the door, it shows the movement of the airflow. Intensive care is a very specific department. So this is the ward of the intensive care. It's equipped with the oxygen equipment, as well as the relevant equipment to examine the blood pressure, oxygen saturation. Also, we have equipment to track the patients. In every ward, there is a specific place in the clean zone for the nurses. So they work in the special equipment office. There they can sort out the drugs given to the patients, and they distribute it according to the scheme, one patient, one nurse. The office is also linked to the electronic system. Here I can see whatever procedures have been prescribed for the specific patient, and then I track it, I monitor him, and I render the relevant service. While I'm distributing the drugs, I'm trying to explain them what and why they are taking these very pills, and what type of consequences may happen, and what type of effect may occur. And all information is available to see by the doctor. Doctor also is aware, basically, about the procedures and drugs we're giving. The patients with the anemia, so we supply them the iron pills with iron and folic acid. So if the drug is not available, then we search for another one, alternative one. We examine ferrotfol, for instance, in the drugstore, and we get it, we assign it, we prescribe it, and we track the consumption. The assigned drugs, prescribed drugs, as well as on a daily basis registered by the nurse, and she delivers the drugs for the patients. The young Mirlan doctor was unable to find in the in-hospital drugstore, so we got in touch with the online with him. Drugs are free of charge, and the payment for the drugs is also done in the online. It's very convenient. No need for the papers, no need for the logbooks. Everything is done in computer. So I put just the pluses so when I give the drugs, and it automatically registers that the drug has been given out. And you can verify both on the computer and physically. So it's all visible and transparent. We're not sitting with the papers, no dust, pile of papers, pile of dust was like 5 years ago. But now it's just an iPad or the notebook. Now it's lunchtime, so that Sulu, the nurse, distributes the first course, second, and third course of meal. The food smell like from the good cafeteria, and it's free of charge for the patients. As for the infection security on a daily basis, it's quartz bulbs are protecting, the intra-hospital safety. TB cells basically die within several minutes as a result of this very light. So the patient goes there, and we go through this way to our own office. The patient submits the sputum we collected, we put it into the box, get a container, and send it to the lab. When the patient leaves, we turn on the ventilation, minus ventilation. When they're moving from the clean to the dirty zone, we supply air, we create the minus pressure so that the air from the dirty zone will not reach the clean zone. We process our hands with antiseptic, and then we go to the clean zone. Later, you will reach, for instance, the nurse's room and the procedures room, and the room for the senior nurse. And the patients with the complex forms of the forms, in spite that we have in the hospital, you can safely go through all the corridors and doors. None of our officers got infected either with the TB nor with hepatitis. It means that the infectious control system works very effectively in terms of carrying out the relevant procedures, protection of the breathing airways. In order to function the hospital in this way, you need to establish not only modern management, but also clear and good system of supply. In Karabalta, it's done by the entire team of the procurement officers. And these are the people who are in charge of this. So based on the electronic cards, we examine what type of drugs are needed. And we went through the special training for this, by the way. And this is our second profession. The preparation for the procurement, assessment of the cost, development of the cost breakdown, development of the supplier identification. It takes a lot of time. Therefore, we have 4 persons in charge of this. And these 4 persons on a regular basis are sent for the retraining, in-depth training programs. So the person becomes quite experienced, and they can easily resolve these issues. Yesterday, for instance, I conducted the bidding for the reagents, and I entered the agreement, and we'll be waiting for the information. Also, office supplies, drugs, and technical support of the filters on the ventilation systems. It's an annual system, annual maintenance. With the view of ensuring transparency and operational activity, all the procurement are conducted in electronic mode. It's done through the official portal of the state procurement system, regardless whether it's a large scale or small scale. The requirement for the drugs is done by the TB doctors. The needs are resolved on regular wages, as the laundry officer Alona says. She used to ask in the past, like iron, air conditioner, stitching machine, but now she's really happy with the dryers. Yeah, when I came here, it was very humid area. Then I requested for the dryer, and they bought the laundry machine and the dryer, of course. In case I need anything, I request, I write the application, it's reviewed. It doesn't happen overnight, of course, but anyway, it happens later. As they say, they bring, they install, and we use. Well, the problem in hospitals should be foreseen beforehand, and these problems should be resolved. And the budget works in this way. When we form the budget, of course, we firstly ensure the protection of the salaries, drugs, and then we can form the other items. And here you can see the Committee of Quality, without approval of which nothing happens in the hospital. Based on the precaz or instruction of the Ministry of Health of Kyrgyz Republic, the Quality Committee is the body which carries out the activity targeted to a permanent improvement of the medical services. Funds and money is basically managed by the quality committee. Economists, accountants say, well, we have this amount of money. Then we take a decision how much we need, for instance, to procure the test kits, equipment, for food, logistics. Everything is decided by the quality committee. Everyone pursues their own goals and objectives. Drugs, something is some their own needs. Nurses, they have their own needs. Doctors, they have their own needs. Lab, they have their own needs. Everyone tries to prove what they need. Laboratory, for instance, we need this. We need the analyzer or test kits for the urine, biochemical tests. We need hematological test kits so that we can comply with the modern requirements of treatment. So we will identify the patients at the clinical level, and the tests will be run at the level of the district hospital. No, it doesn't work in this way. They prove their own approach. So the kitchen comes and say, well, we cannot cook food which is needed for the specific patients, like mashed vegetables or cream soups or some salads. Our hospital is not big, so therefore the workload's not that much. One cook and one assistant. So that's why we bought the equipment that can meet all the needs, like the blenders, the pancakers, as well as the cutlets, fryers. The juices are immediately cooked, not in the way it was in the past, like in the big jars. No. So we have also removed the bathtubs. So we installed the showers because for the patients it's quite difficult to get into the bathtub. So the patients can sit on the chair and they can shower. So we're trying to do in the way that it will be quality. If you look like what was like 10 or 12 years ago, they installed like the heaters. This year, we can simply remove them, clean them, and we install them back. You don't have to patch them. If we install the window frames, you can simply change the rubbers, you can change the handles, that's it. We can count only on that money that we can earn. This is the way the rational management of the finance transformed into quality. So now the management of the hospital is difficult to answer them, whether money brings quality or quality brings money. Well, of course, we try to automate everything. It excludes the needs for the big number of the assistants. Of course, we try to make the life of our offices easier, and then we switch to the digitalization, management of modern equipment, diagnostic equipment that helped us to our facility to render all services recommended by the World Health Organization. And then we have been noticed, and they allow us to introduce new drugs. And the drug management, again, is linked to the financing, to the duration of the patients had also reduced. And it increased the number of successful treatment cases that helped us to perform our contracts with the funds. Yeah, receiving the funds for the successful treatment is very much helpful for us to get money timely, good money, you know. Well, until recently, I was thinking I'm a good doctor, but when we started to assess all of this and to participate in this now, I believe that I'm a manager, more manager rather than doctor. Manager as a manager, but the modern manager should have modern assistants. If in the past I had to go floor to floor, now I can do it everything online, like to track how the patients are being treated, how they're served, how they're being fed, how the nurses are performing their duties, how they're performing all necessary requirements in terms of safety and security. So while I'm in the office, I can see whether we're performing the safety on the intra-hospital infection issues. Our computers are our analytical brains to see what is going on, how is it going, and to control the patient's flow. If I see that something is not happening fast, that of course I can support, I can help, and this is the way we're trying to help. We're developing different type of activities, and I see that this year, whether we'll make good money this month or we'll make not that good money this month, planning the best. This helped Karabalta Hospital to go to the new approach.
Показала, современный вид финансирования вкупе с прогрессивными методами управления именно
this type of financing plus progressive management techniques and the capacity of our human resources make this success possible. Most importantly, the position and the status of our hospital depends on us, and people have to understand that. So, as for our beds, well, back then we didn't reach the set targets, and we didn't have the required facilities, and now thanks to that now we have the present day building, modern one, and I'm pleased to see that it's all good in our hospital. I can feel I'm a present day doctor. It's not like before when I had to use the pen, and now I click the button, I make the prescription, and the nurse even doesn't have to stand up because the information is submitted to her room immediately, and I'm happy about that. And the key point is that we have very good team of professionals. Every year the situation improves, and my health status improved even. And not to and not to bring shame on our hospital, or we keep on trying. And I live here, I work here, so we need to maintain the good image of our hospital, and everyone is responsible, and everyone is working well, and all staff members feel their responsibility. That's why we have such procedures. Dear colleagues, first of all, I would like to thank our great team of Karabalta TB Hospital, led by Zamira Rashidovna, and in fact, this video was developed thanks to Nuria. Please show us Nuria and her sleepless nights. So she's one of the developers, and actually you could hear her voice in that video. And Zamira Rashidovna, we saw her in the video. Zamira, yes, that's her. And Zamira Rashidovna, in the video, she was without a mask, but she is equally beautiful as in the video. And I beg we will not see him, but colleagues, we could see him in the morning, the guy with the camera. And so, colleagues, put your questions on the chat. We will discuss hospital financing after lunch. And now I would like to give the floor to the Fund of Kazakhstan, Ilyas Mohamedjanov, Mandatory Health Insurance Fund, Kazakhstan.
Dear colleagues, I'm glad to welcome everyone on this conference. Добрый день, уважаемые коллеги, очень рад присутствовать.
Dear colleagues, I'm pleased to welcome you and to participate in this conference. Let me say that all the speakers were quite positive. Very good information was provided, very good focus, and despite the fact that Kyrgyzstan and Kazakhstan have slightly different approaches to financing, but the ultimate goal of health facilities and the health insurance fund is the world without TB. And I would like to thank all the speakers once again. I would like to highlight the presentation, which I personally like, the PhD level incentives. And it's a very interesting approach promoting not only operations of doctors, but mostly district physicians and nurses, family doctors, managing their patients. And focus on PHC is, well, has long been in progress, and when every year we keep noting that that decision to focus more on PHC was correct, and I guess it is also related to the Astana Declaration as of 2018 and the declaration. And actually, the focus is that the PHC sector will dominate, and it will be the primary focus, especially when combating such a socially significant disease as TB. And the questions in the chat, I read them, so very good and high quality answers were provided. So we learned a lot about that, and hopefully we will use them in our work. And I would like to say that the Health Insurance Fund of Kyrgyzstan has broader experience in financing and approaches to financing. They've been working since 2012. So I guess we are younger, but we will be happy to adopt our colleagues' experience, and later on we will share our own achievements as well. Thank you. Thank you, Ilyas, for your valuable comments. And dear colleagues, I would like to wish you strong health, success to the mandatory health insurance fund. And we do know that you are facing a lot of challenges. You have a vast area, and you have different approaches. And not always you can use the same tools, and you always have to carefully adapt the global financing tools to your settings. And every success to you. So let us continue our today's conference. So dear colleagues, we are having several more minutes before lunch. And so do we have an opportunity to give the floor to someone, or maybe we can arrange a 10-minute discussion? So we have some 10 minutes and we can use them. Now, dear colleague, dear, yes, please. Dear colleagues, dear Marat, I'm pleased to be part of that on our day 3. I apologize, I couldn't make it in the morning, but I had a lot of other responsibilities. Since the very morning, I've been watching you, looking like what's been done here. And actually, Kyrgyzstan is ahead of other countries in terms of switching to new financing principles, and your valuable experience is of great importance to us, because all the other countries that are switching gradually to this mode of financing will use your experience. And I'm especially pleased to know that you are doing this with pleasure, and you have under all the challenges. And for us to avoid these challenges, you are helping us in this. So thank you so very much. And every success to you. And I guess at the end of the day, we will thank USAID and APT because you gave us this opportunity to get connected. Although we are in different countries, but we are on the same way. We are implementing the same objective. We are combating to be in our respective countries and enjoying support from our international partners. I hope this platform was established for us so we could share our experience. And while sharing our experience again, in all our countries, hopefully we will reach the same results. So finally, we could eliminate TB in the whole region. Thank you once again very much. And I wish you every success in your daily operations and at our today's conference. Thank you so very much. Thank you, Nargiz Nusratovna, for your kind words, for your comments, and I guess you will get back to us. No, I'm here. I just switched off my camera and my mic, but I'm here. I'm listening to you with great pleasure. Thank you. Every success to you. So we just had Nargiza Nusratovna Parpieva, Director of the National TB Program, Uzbekistan. So, dear colleagues, I guess we need to switch to lunch, and 1 hour later, we will get back to the participants in the hall. And dear online participants, we will continue 1 hour later. We have equally interesting virtual tours to the primary health care level. I guess there we will have the most interesting part, the primary care level. And there we will have discussions, questions, and answers. I guess it all will be of great interest to you. So please, you are all invited to lunch.
Добрый день.
Good afternoon, distinguished colleagues. Let's continue our afternoon session. And unfortunately, we didn't have a chance to comment regarding the virtual visit that has been demonstrated to our Republican TB hospital. So really would like to provide you with a very brief overview and comments on what you have seen in this very footage. So the floor has been requested by Mr. Amarat Karataev so that he can provide the very brief feedback. Please. Distinguished colleagues, we all have seen very short footage about Republican anti-TB hospital in Karagabalta. What I would like to mention here, first of all, we have seen in which phase and what is the state of what was the state of the asset base of this very equipment, of this very facility. You have seen how corridors, walls, bathrooms, toilets were in the past. And by taking this chance, I would like to extend my thanks to Mrs. Zamira Rashidova for organizing an improvement of the asset base so that now we have a new image, new look. It demonstrates that it's nice to visit, it's nice to see, and theater basically starts with the wardroom or the walls are supposed to heal the patients. That's another kind of a proverb or the saying that comes from the doctors community. So everything is built according to the standard. So we have installed the relevant equipment. You have seen with your own eyes the lab service, the diagnostic service, by using the efficient methods, they purchase the relevant equipment that meets the standards. And from here, the indicators of the TB treatment facility is much higher compared to other facilities and other hospitals, and therefore they attain very good results there. Thirdly, you have seen the informational system as it has been demonstrated in the footage, like the types of the outpatient cards or the patient disease history card. All of this has been transformed into electronic format. This again demonstrates that communication, information, obtaining information, operational analysis of information, all of this is set in the correct way. So therefore, as you have seen, we need to attain not only the situation when the Republican hospital like Karagabalta, we need to transform the other hospitals to the same level so that they will be performing in the same environment, with the same funds, with the same amount of financing. The most important, the funds should be used effectively. Yes, there were certain episodes about the computer equipment that has been supplied by international organizations. So therefore, I would like to extend my thanks to USAID, to Mrs. Ainur Sultanova for their support. But we are not giving up. We'll continue to search for another alternative source of financing. What is the most important is the initiative, that the work of our managers, as Mrs. Amira has mentioned, until 2012, I was a TB doctor, then I became a manager. Yeah, we want that all our managers, directors, first of all, should be able to demonstrate how they can perform as a director, as a manager, and as a professional, as a qualified doctor. So once again, I would like to thank Mrs. Damira Rashidovna, in your person, your entire team, as well as other facilities. I would like to call other hospitals to get this experience and to be as close to the level they're performing to possible. Thank you very much, Mr. Marat Malaminovich. And now the floor goes to the funds of the compulsory medical insurance. Mrs. Zamira has mentioned a number of times that they maintain very good contacts with the fund, and it's built not on the vertically, but also on the horizontal interaction. And the lead here is the contractual agreements that they're entering to. Please, Mrs. Zamira. Clara, please. Yes, thank you very much. Well, you know what? I really would like to put an emphasis that initially, when we were creating the unified PE, we were thinking about the new method of financing. And it has been noted for a number of times in the footage that this is the shift from financing the bed-based approach to the unit, which is the final result. I would like to know that the financing comes only on one item without breakdown into the items. We're approving only one budget. And on the basis of our interaction, these are the contractual relations. We are partners. We carry out our activity. Each party has its own liability and responsibility. So in this regard, we're speaking that the organizations of health facilities and their managers, they become the managers because to a great extent, they manage their budget. They manage their organization and they're entitled to decide where to allocate the funds. And they're entitled to decide which staffing they need, whatever costs or expenses they will incur. And here, as Ms. Zamira has mentioned, here we need a manager, and the good manager and of good level, because unfortunately the funds are not that much. There is always limited funds. But even within this very limited resources, you can use these resources effectively to build a good rationalized system. And then from what you have, you can make what you have seen on the video. All organizations are based on this type of approach. All of them, they obtain non-item based financing. And plus, every agency has similar opportunities to improve their activity. Thank you very much, Ms. Clara. Distinguished colleagues, now we'll start the downloading to the primary care level from the hospital level. But before speaking about the primary care level, I would like to say that participants from Tajikistan, Kazakhstan, Uzbekistan, and Turkmenistan, I would like to remind you about our discussion that will happen after the second footage and discussion, so that every country at least should answer to 3 questions. The first question was, what experience was useful for you? The second one, which areas are prospectively interesting for you? And the third one, what type of assistance do you need to attain your new tasks? Therefore, distinguished colleagues, our session is planned like in 2 hours on those questions I have voiced. And now let's move to the next virtual visit. This is a virtual visit, a Center of Family Medicine. And we're going to present a footage financing the successful treatment of TB at the level of the primary care based on the case management approach. Please.
Как вы знаете, туберкулезная
As you may know, TB service has been represented by the outpatients treatment. But in spite of the fact that in the country we have had a lot of TB hospitals, and practically all TB patients were hospitalized, epidemiological situation has not changed. The growth of prevalence with the drug-resistant TB form has caused, like in any organization, quite a reasonable question. To what extent our hospitals are effective? And here, there is a question. How we can use effectively our financial resources so that we can create a good stimulus for the doctors, for the professionals, for the wider coverage of all patients in terms of treatment. Thanks to our joint efforts, we developed a model where we have introduced the financing stimulus at the level of the primary care for successful treatment at the outpatient. Innovative financing of the TB services rendered at the outpatient level. In Kyrgyzstan, they're introducing together with the fund of financing of health and obligatory or mandatory medical insurance, together with the USAID. So they're creating the incentives of financial ones can improve the quality of every case of TB with obtaining positive results. at the outpatient level to obtain good result, what we're trying to do, I mean the doctors and the nurses on the primary care, is the most important that the patient in the home environment under the control of the doctors and nurses will be able to complete the treatment course so that the disease will not transform into the more resistant form, which is longer to treat. And financially, of course, it's quite difficult for the patient and for the state. In Kyrgyzstan, the treatment is based on the well-known medical approach titled TB case management, with one important innovation. If in many countries the case management is dealt by the non-government sector, in Kyrgyzstan, according to the fund of the compulsory medical insurance and the Ministry of Health, who have introduced the relevant scheme with the good motivations for the doctors and nurses of the primary care. Depending on the peculiarity of every individual case, the case management of the TB can include the following: convenient for the patient organization of the treatment that defines where he or she is going to get treatment, who will be in charge of the treatment, if needed, who will be selected as a volunteer assistant, or how to organize the video-controlled treatment. The clinical monitoring, like when and what type of examination should be done, what type of samples should be collected, what type of counseling is carried out, and how to overcome the after effects. For this purpose, we need to study the social situation of the patient, his family, and to produce positive impact so that he or she will be adherent to the treatment. Psychological support is very much important, right from the beginning of the treatment, by the doctors, by the close ones, by the kins, and to render qualified psychological assistance. Social support, it's important to understand in which social support the patient needs, and to mobilize the state and other organizations to provide this type of assistance. And finally, examination of people who are in contact with the patients. A very nice doctor. Girls here daily bringing me drugs, and for 3 or 4 months I'm getting this very treatment. They bring the drugs and they leave. I really would like to thank them. They are taking very good care after us. Today, this very patient is absolutely healthy. She knows very well that the entire team of doctors were working to support her, including the representatives of financing organizations, the fund of the compulsory medical treatment, and they're forming their own team that is being adequately paid. It includes the people who are in charge of the primary care, who are in charge of the treatment, TB doctor that sets the diagnosis and that identifies and coordinates the activity of the team, family doctor who controls all the treatment process, organizes the relevant treatment, consults the patient and his or her close ones, as well as takes relevant measures to eradicate after effects and provide psychological and social support, carries out investigation of those people who are in contact. Rural doctor or the family nurse who interacts with all the close ones and provides the relevant monitoring of the treatment, obtaining the results of lab studies and tests. They're also in charge in terms of arranging availability of the drugs. We are not limited only with the drugs, so we should also communicate with these people, like what is the source of concern for them? How can we help them? How can we do it in a way that the patient will not withdraw from the treatment? Doctor and nurse are the friends of this very family, so that the patient will be able to disclose himself or herself, so that they will go through the successful treatment. Considering that the doctors of the primary care have new functions, like the members of the team on the case management, it's quite logical that they should be adequately paid. Of course, there was a big activities, all the costs have been well analyzed. We've conducted the calculation. We have identified the standards for the susceptible and for the resistance form of the TB, and the funds arriving from the state budget. All this data is being examined and monitored on an annual basis. It's well protected kind of items of the expenses. According to the law of the Kyrgyz Republic on the obligatory medical insurance, the denial of payment for the primary care doctors for treatment, 12,000 sum for the susceptible form of TB and 24,000 sum for drug-resistant form of the disease. It's distributed among the team members based on the efforts they're taking. It's paid to the nurses who are monitoring the assistants, and to the doctors and to the experts of the family medicine, which are the major members of the team. The head of the facility and increasing their responsibility is really important here. However, it has been determined that the major burden goes to the doctor. It was decided that half of the payment will go to them. We closely interact with the patients, and we send to the laboratory.
Карточкаларына чаптап фтизиатрга мына ошондо ал текшерип турат фтизиатр. Анан күнүгө дары беребиз.
The TB doctor controls the process, and they come with us in depression. That's why we have to talk to them. And even you don't have the mood for that, you have to pay attention to them. We laugh together, we cry together until they get fully cured. Throughout the last 3 years, the new financing system is being implemented in pilot provinces and districts with gradual expansion. And currently, out of 7 provinces of the country, 4 are fully covered, plus several districts of another 2 districts. And to make it stable and part of the fund system, extensive work has been done, which is not visible to the public at large, aimed to reorganize and optimize the TB service, to predetermine the implementation of new financing arrangements. And in 2015, overall, we had 29 TB facilities, and now we have 29 were optimized, reorganized, and the savings were channeled to the TB service, so no one withdrew them or channeled them to some other expenditure items. No, the savings remained in the system, so it meant opportunities to implement case-based systems at the outpatient level. So optimization will continue, and all the funds will go to payments per cases treated in other districts, in other provinces. So we plan to expand utilization of this payment method later on. So payments for TB treatment success is a good incentive for health professionals engaged in TB treatment at the outpatient level. So those bonuses are part of the salary. They can be channeled to something else. So, oh, that was so good. We were so pleased. So all ladies, family nurses, we were all happy because it means the state really appreciates what we do. When we first got the money, we got so happy. And I even bought a table. And in the village, there is another nurse, and she's like joking. So, yes, you bought a table as a result of getting the TB money. And if the state knows and values us, if the patients get cured, so because money is given only for the cured patients, it means the work is good. And sometimes they receive just one big pool of money. And when other doctors hear that, because the morning 5-minute sessions, they normally discuss it. And when the director is announcing, like, you will get that much, so many thousands on that day, normally doctors are shocked, like, why it's not us who get so much money. And the past experience has shown that material incentives based on treatment successes really motivates health professionals to improve the quality of services they provide. And let us remind you that this is state financing via the mandatory health insurance fund, and it's not additional funds. These are the savings as a result of optimization and restructuring of TB service. So it means that non-effective TB hospitals were closed, as mentioned before, by the fund's leadership. Over the last 6 years, some 10 hospitals were reorganized, and that process will continue following a relevant program. So, financial incentives, when they are appropriately designed, they can have quite a high impact. So the very understanding of a TB patient, the very understanding of TB as disease changed in health professionals at the primary healthcare level. So now everyone is saying it's all should be patient-centered. That's why the funds and the financial system is designed the same way. So it could be patient-oriented. So payments should be provided for the final outcomes, and all financial resources should be utilized. And this project is a demonstration of how, using limited funds, you can contribute quite well to treatment of TB patients, and we are happy we managed to do this. And meanwhile, the patients of medical teams under TB case management continue their treatment, get back to their normal life, and plan for the future. So I have some good plans for the future. When I recover, I have to implement all this. The key point is I could be healthy.
Спасибо.
Thank you. And to discuss this virtual visit, the participants requested the floor. The participants from Talas province, where it was implemented in 2018, and it is my pleasure to give the floor to Director of Talas Provincial TB Center. Hello, dear international conference participants. Before lunch, we had an animated discussion of how it all was implemented, and we would like to share our experience, limited experience, like how that system works at provincial and district levels. So as mentioned by Aynura Sultanovna, Talas province introduced that system in January 2018, and so far 623 cases were paid. And as mentioned by our colleagues in the video, we also could say our personnel experienced the same wonderful emotions as the participants in the video. And so far in Talas province in 2018, we organized training, family nurses, family doctors, representatives of the center's administration, so of general practice and family medicine centers received that training, as well as economists and managers, and jointly with the mandatory health insurance fund. Back then, frankly speaking, we had concerns like how that system would work, but it all went perfect. And as a director of the Family Medicine Center, I can say it's an incentive to retain people at primary healthcare facilities, since you know yourself that in the provinces, the worst problem is with human resources, because the lack of human resources is so severe. And even despite 20% and 20% bonus provided to general practitioners is also another incentive to retain personnel at PHC level. Well, unfortunately, the salaries are not really high, and we could see from the video that since sometimes they receive 6,000, some or 12,000, some, that's great because it means 1 or 2 extra salaries for them as bonuses, and the system is well performing, and we would like to wish every success to the remaining provinces. Don't be afraid, the system is working, and now it is one of the most pleasant aspects of our work. And if we discuss like how the PHC will develop later on, it's one of the steps aimed at our autonomy, greater independence, because the nurses are saying it's not just one of the routine programs like another one. No, here you have dynamic communication with patients, daily monitoring of patient status, the whole team of professionals, and that team spirit somehow makes the team work and make it elevate to some new stages. And soon we can expect new forms of incentives, which later on will demonstrate good results in the country, and hopefully we will be able to share them with our colleagues in the near abroad. Thank you, Jamal. And I guess you're the right person to share your understanding and to engage in that discussion when we discuss reforms in the TB sector. Of course, there are a lot of challenges, but this is not to be done overnight and even within 1 year. So it's a lengthy, long-term process, and it needs to develop in a phased manner. So we have a comment or a question. So can you please connect to Shanbe? Aktam Ikramovich, please take the floor. Thank you very much. I have a short comment and a question. Of course, it's a very interesting experience, what we've just heard and seen. And you know, I guess in Tajikistan, we have long started planning. I hope you can hear me. Can you? Yes, we can. Please continue. So we have long started planning financing reforms in general and financing in TB sector in particular, but it happened so. A lot has changed and priority has changed in the Ministry of Health. And taking this opportunity today, since USAID Ethica project has international specialists in financing reforms, we again raise those issues. So we plan that, and it's available in our action plans, and we plan to start capitation in the hospital sector. And we visited Bishkek many years ago to take a look at Kyrgyzstan's experience, perfect experience, and I'm happy to see that you advanced a lot. And my question is, at stage 1, anyway, it's best to start with hospitals or with PHC level. So what should be the staging? Thank you, Aktam Ikramovich. It's a very correct question. In terms of development of the financing system, so what is the best level to start, primary or secondary? I don't know who to give the floor to give the answer to the fund. Maybe NTP or the fund will. I guess we can split it. So Madamin, you can present the clinician's view, and Clara will speak for a financial expert. So what do we start with? Financial experts. So Musayevich is giving the floor to the fund, and the fund will say what you should start your financing reforms with, primary health sector or hospitals. Thank you for your question. You know what? We have discussed already that in principle, the TB service was all represented by hospitals. And that's why, first of all, we went for the hospital level to optimize it and to release some funds. So in Kyrgyz budget, there were no additional resources, and to find resources and to switch to another level, we had to find those funds. And that's why we introduced the single payer system for all hospitals. We switched to case-based payments, and actually it took us 6 years since 2012 to 2018. And when that process became established, when we could see the first results, when we got the first savings, it's then when we could consider effective utilization. And only in 2017, we switched to outpatient TB management financing. Thank you, Clara. And now, Musayevich, Voloktam Ikramovich, you are raising a very good question. You are perfectly aware of that. So primary care is way more complicated compared to hospitals. I guess coordinators will confirm. So in hospitals, you have a limited number of beds, and you know the how to take that into account, like hospital stays, beds, and so on. And what I mentioned in my presentation, so 20% decreased case detection rate and losses, and also in Tajikistan you have issues with external and internal migration. So the easiest point, as Confucius said, so the journey of 1,000 miles starts with the first step. So to have clear accounting and timely response, I agree with Clara. You have to start with hospitals, and only then gradually you have to switch to outpatient sector. Thank you, Madamin Musayevich. Clara's response is okay, is correct, but when we are discussing financing reform, so we have to take into account where the money is, and it's mostly with the hospital level. And then as for family medicine centers, as for the same experience with primary healthcare level, I would like to give the floor to Ainura, director of the General Practice Center district, and they have yet to introduce that system, and they are at the very initial stage. So don't be shy, switch on your mic and tell us what you will do as your first and second step. We could see how you distribute your funds you receive as payment for case-based payments. And yes, please. So good afternoon, dear conference participants. I apologize. I will speak in this state language, if I may. Speaking in Kyrgyz.
Слышно? Здравствуйте.
I hope you can hear me. dear participants. In the district, we started implementation of the TB case management approach, and we hope for good results.
Учурдун бир приоритеттүү жакшы бир нерсеси катары калыстыкты ар бир медициналык кызматкердин өзүнүн заслугасына жараша, эмгегине жараша өзүнүн ролун сезе билгидей болгон жакшы иш катары бардыгыбыздан чоң натыйжаларды күтүп атабыз. Анан эми бизде болсо бул электрондук регистр жакшы жүрүп жатат. Биздин кызматкерлердин бардыгы окутулуп, мындай айтканда даярдыктан өтүшкөн да. Анан азыркы күндө биздин райондо 13 оорулуу дарыланып жатат. Анын бардыгы өз учурунда электрондук регистрге киргизилген.
Эта система очень
So this system is timely, is a high priority, and hopefully we can handle that, and hopefully contribution of each and every specialist will be taken into account in terms of patient management. And I would like to highlight that the electronic register is being introduced, and now we have 13 TB patients, and data on those patients are entered to the TB register.
Аткарууга даярбыз, мындай айтканда. Анан бүгүнкү күндө биздин райондо 4 успешное завершение лечения болду деп эсептеп жатабыз. Эми аларды верификацияга бердик, мындай айтканда. Анын ичинен бирөөсү излечение болуп жатат. Ошондуктан бул верификациядан биздин кызматкерлерге финансылык бөлүштүрүүлөр туура жүргүзүлөт деп ойлойбуз. Ар ким өзүнүн заслугасына жараша, өзүнүн эмгегине жараша алат деген үмүттөбүз.
У нас команды.
Well, our teams in the area of case management is well formed. Starting from the director up to the nurse, they are ready to implement their functions. We have 4 cases of successful completion of the treatment, which is referred for the verification. One of them is cured, and upon the completion of the verification, our officers will get their payment. Thank you. Inur Shirimbekovna, thank you very much. We will continue our discussion. And are there any questions in the chat? Rahat, please voice out the question. Well, there is a question from Nicholas Nasidze. The question goes regarding the parallel testing of TB and COVID, whether they conduct this type of testing in our country. If yes, then how? Should I voice it out? Currently, the Ministry of Health, with the support of the TB control project, together with the relevant screening starting in March 21, so there is a parallel screening for TB and COVID-19. So according to this confirmed algorithm, the persons who has both the TB and the COVID, you can see that they have long-term cough, and they collect the sputum samples for the TB test. This very initiative in the process of implementation, and they will develop recommendations on this. Thank you very much, Rahat, distinguished colleagues. We have questions from Dushanbe. Please connect Dushanbe. The microphone goes to you. Dushanbe. Thank you very much. My name is Farukh Egamov. I'm an expert on financing health. Well, we are dealing with the implementation of the reforms in terms of health financing in the Republic, and we have been planning to introduce the system of procurement, of strategic procurement at the oblast level. So we have selected the pilot oblast. It's a SOGD oblast, and within the framework of this very pilot, we have identified the system based on the piloting. It will be a unified payee system on the basis of the health department of SOGD Oblast. We also have the pilot districts. So first we would like to introduce the system of procurement at the level of the primary care through contracting the services at the primary care level. And we're planning to develop the package of basic state guarantees. And within the framework of the technical group within the Minister of Health, which functions in the reforming the TB service, will consider the implementation of the new mechanisms within the framework of this very project. And I have the following question from the Kyrgyzstan experience. What do you think? You have established all the environment for the procurement system. So within a framework of the fund, you have organized the unified payee and the suppliers system. What do you think within our pilot? Is there any sense to introduce the contracting methodology between two state agencies, like between the SOGD Health Department and other suppliers of the services, which are state institutions? Thank you. Thank you very much, Farukh. A very interesting question. Within the framework of one institution of the Ministry of Health, whether it's possible to enter into contracts, like state institution to state institution. I believe that some of my colleagues can answer to this question because they are all state institutions within the Ministry of Health. Please, Ms. Clara. Well, actually, probably it's not really important, like who are the parties of the contract. What is really important is the text body of the contract. It is possible if within your Department of Health and health organization, you will be able to enter contracts for specific types of services. The second point, which we wanted to mention about the strategic procurement, if you remember, in our presentation, we have demonstrated when the TB has become the part of the unified PE system, there was only one system. It's quite difficult based on a very small information, to do kind of a strategic planning of procurement. You need a good system, good analysis, and good database in order to identify what type of services can be contracted, outsourced, in which amount. This requires some time, and you need to develop this sort of statistical database of all information and all data. Thank you very much, Ms. Clara Turkumbekova. Ainura, please. Yeah, I would agree with Mrs. Clara. Here, I would like to draw your attention, dear colleagues, that the contract is signed between two parties. In your case, that's the SOGD, Department of Health, and supplier of health services. So here, what is really important is to describe the functions of the SOGD Department of Health and the treatment facility or the organization. Here you need to write out the functions. The second one, in the level of functions, to carry out clear division of supplier and the payer for medical services. In your case, the supplier of the services is the organization of health, like TB hospital or center within the primary care, while your Department of Health the procurer of the medical services. And also you need to divide like the supervision functions so that it will be clear to understand, so that to avoid that it will not be a situation that just based on the SOG health department that the supplier will be both in terms of in charge of the quality, at the same time he or she will be supplying and will be paying for this. No, this is what you have to avoid. Thank you. Thank you very much, Ainur Sultan. Well, I believe that as for the primary level, well, I think we'll get back to it again and again. We have another plenary session. I think that for the supplier services, there are a lot of technical issues. Well, let's continue our virtual communication on the primary care level, and now would like to request to turn on the footage on the verification of the TB case at the primary level, primary care level. Please turn on the video. Verification of TB case at primary care level. This is the final footage, after which I got sick, and probably because of my low immune system, I got this very infection. I went through the X-ray examination, and of course I felt bad. And I had sugar diabetes at the same time. So I had a really strong stress. It was really difficult for me. I was on torture. It was pain, it was dizziness. I didn't have kind of a deficiency of air. I was coughing. It was very dry cough. And it was a permanent weak feeling. The history of TB disease is very specific to every patient. But how to get overcome this disease? The disease will be suppressed when the doctor will be able to set the correct diagnosis. Therefore, in the pilot project, detection of the TB done by the specific team which carries out the treatment with a framework titled the TB case management, which is implemented in the medical practice of the country together with the Ministry of Health and the fund of the mandatory insurance with the support of the USAID. Upon the successful completion of the treatment, the work of every team member will be paid from the obligatory or mandatory medical insurance fund. All the data about the patient and information about the treatment is inputted and updated in the special electronic form TB01, which is the part of the information TB database. In the end, the history for the patient is tried at the concilium level. Well, the concilium mainly goes for the drug-resistant TB. So we discuss once every 3 months. So for the monitoring purposes, we need to supply the sputum of the patient, that it should be not just on the words, but at the same time it should be monitored practically. And in addition, of course, if there are some difficult issues specific to the resolution of the TB, if there are certain kind of nuances, of course, we submit this for discussion. Now, because of the verification, we present every treated case, regardless of the type, whether it's susceptible or sensitive or resistant. It's discussed and debriefed by the concilium in order to identify the method of treatment. Today, the regional concilium, Yildiz Isakova is making the representation. Information about the case is presented in the system of electronic TB registry, where every district TB doctor has access on his account name. Well, the patient born in 1962 registered in the center of the practice. He addressed to the family doctor with the complaints. The family doctor referred to the TB expert. The person submitted the sputum, and we have identified the XDR form of TB. Never was sick before, but in this very situation, it's bacteriological confirmed XDR. interactive TB in the upper parts. Moreover, the patient has sugar diabetes. Well, carnitine, isoniazid, clofazimine, moxifloxacin, pyrazinamide, pratilamide, and pratambutol. On the background of the treatment, there were some undesired effects like vomiting as a result of response to the drugs. The scheme is presented. We have cooped him with the anti-vomiting drugs. We have been filling the dairy since the first day of treatment. It's an X-ray positive dynamic, and the objective of the report is based on the outcomes. Now the concealum has to examine, to assess the efficiency, to examine the reliability of the information, and after that, to identify the relevant outcome of the treatment. And another important function of the concealum is that to control the full-fledgedness of filling TB card 01, because only quality-filled card will be useful for the obtaining the payment. Yes, distinguished colleagues. Today, I am presenting the outcome of the treatment. Treatment is closed. It was good commitment. So upon the completion of the concilium, Julius has to change the status of the patient in the TB registry. If the patient used to be registered as on treatment, now the treatment is over. Having received this type of signal, system will automatically form the relevant notification and will send it to another electronic information system. The system of the fund of the obligatory insurance will indicate that the person has got the treatment in the primary care for verification. So before making the payment, the verification should be done. The verification is done only for the TB cases with successful treatment. Verification is done at the level of the oblast concilium in the oblast hospital. Well, we having information that the person has been cured, fully cured, then the information is verified. Then basically we get the information that the result of the treatment is successful, no other infection is being identified, and then we start working with this, continue working with this patient. Well, okay, of course, first we person is examined. I mean, the card is examined by the nurse whether everything is filled, and then doctor TB expert examines all the card. If needed, he or she adds. Then it's examined by the concealum, and then based on the verification of the examination of the concealum, we verify this data. Different from the TB registry, which is a type of a working instrument of the physician. The doctors or the database is collected and processed based on the TB, which is verified and submitted for, upon the verification, submitted for the payment. This provides the transparency and reliability for the successful treatment of TB as a primary care and forms the relevant statistics. After verification, the next phase of the electronic method of notification for the payment is authorization, which is done by the fund of obligatory medical insurance. Well, we have seen how many days the person who has gone through the treatment and what type of treatment has been rendered, whether it was compliant or not compliant, whether it's MDR or XDR, and I can also check in the base how many notifications are there, how much of them have been authorized, how much has been paid, how much has not been paid. So it's a kind of in-depth analysis. And if needed, I can verify it. If everything goes well, then I authorize. So we give the permission then. And then the information goes to the financial department. On the 25th, the territorial department submits the information for financing. Then the central apparatus examines this information, and based on that, they conduct the examination. It's a budget procedure. It goes through the treasury.
Then it comes to operational accounts of health facilities, and this procedure is electronic, it's fast, no papers, no advance financial department of this fund.
Организацию здравоохранения, откуда и пришло уведомление.
Как только деньги
So
поступают,
the notification, the claim finally becomes real money. And then the money will go to the primary health facility from which the notification came. So when the funds come to our financial at the PHC level, then the accounting office makes relevant calculations and the funds go to the personnel debit card. Yeah. So the funds are earmarked, so you can channel them to some other needs. It's only salaries and bonuses for cases treated, for participation in treatment of TB patients. So information on successfully treated TB cases at the PHC level having undergone the invisible electronic path from the PHC facility to the front via verification at continuum at the provincial TB center and authorization in the fund. Finally, this information is transformed into real money. As a result, health professionals get real remuneration. For the first time, the incentives to health professionals for successful treatment was implemented by the Ministry of Health and the fund as a pilot USAID project in 2 provinces since November 2017, followed by Talash province and several districts of Jalalabad and Dosh provinces starting 2021, again with the technical support from USAID. Naryn and Balkan provinces will be covered. Thank you very much. Colleagues, if you have any questions, you can write them in the chat. But now I would like to ask the director of the local fund office for Talas province, Mr. Olan, please comment on the video, because they went second after 2 provinces to implement this technique, and I guess he has a lot to say.
Конференцияның қатысушылары, өзіңіздер жақсы білгендей, біздің ушул кургак учук менен жабыркаган жарандарыбызды амбулатордук шартта дарылоо ыкмасы 2018 жылдан баштап иштеп келет. Мен кыскача ошол статистиканы айтып коеюн. 2018 жылы ошол жана кургак учуктун туруктуу формасы, кургак учуктун сезгич формасы деп жалпы 168 адам жаран дарыланган болсо, айыл 2019 жылы 207 жаран, 2020 жылы 172.
Добрый день, уважаемые участники. Как вы знаете, с 2018
Good afternoon, dear participants. Since 2018, as you know, we started working to treat patients at outpatient level. I would like to share some of the results. In 2018, we had 168 persons TB patients. In 2019, 207, and in 2020, we had 172 patients.
Ошолорго жалпы суммасы 10 миллион сомго жакын акча каражаты. Ошол биздин ошол жарандар менен тыгыз байланышта иштеген, амбулатордук шартта тыгыз байланышта иштеген медициналык кызматкерлерге стимулдаштыруу кошумча каражаттар төлөнүп берилди.
В 2021 году
In 2021, in patients overall, 623 patients. Overall, payment for successful treatment count for more than 11 million. So this is what the health professionals got.
Қызметкерлерге аудан чоң стимул болды. Анткени ушул баягы кошумча каражат алуу менен алар ушул биздин курагыч менен жабыркаган жарандарга чоң бир топ ушул көңүл буруп ушул жардамы аудан бир жашыл десек болот.
Таким образом, сотрудники первичной
Thus, PHC level professionals got good incentives. So in addition to material incentives, they could also provide great support to help patients finish their treatment.
Баштап уюмдагы ошондой эле фтизиатр биздин дарыгерлерибиз ушуну баягы онлайн түрүндө верификация, авторизация деген маселелер боюнча бир кыйналабыз деген чочулар болгон. Бирок бүгүнкү күндө ушул өзүнүн огунда жүрүп, жакшынакай өз жолунда жакшынакай жумуш жүрүп атат деп айтсам болот да.
В начале работы в 2018 году
In the beginning, in 2018, we had concerns like how the PHC and TB sectors could work, how verification would work, but now it's all well established.
Борборлорго берилген абдан туура болду. Анткени ошол жерде иштеген биздин фтизиатр дарыгерлерибиз ошол тармактын өзүнө спец болгондон кийин ошолор баягы чогуу чаран консилиум өткөзүп, ошону одобрение кылып, бизге оплатага верификация кылып бергени бул абдан жакшы идея болду. Ошол буюрса ишке аша баштады. Что баягы биздин врач эксперттер дагы авторизация жөнөтөрдө, оплатага жөнөтөрдө ошонун баардыгын уверенно баягы бир жакшы деңгээлге жөнөткөнгө мүмкүнчүлүк түзүлдү деп айтсам болот да.
С этого года верификация.
Starting this year, verification is transferred to provincial TB centers, and it's very good because our experts, after verification by provincial concilium, can safely send it for authorization.
Сиздин учуруңузда сиз ушул фомустун төрагасы болуп турган учурда келди эле. Ошол сиздин убагыңызда да жакшы проекттер ишке ашты эле. Жакшы иш алып барып, жакшы иштеп жүрүп атат. Анан ошол менен бирге Айнура Султановна ушул жанагы ушул ЮНИСЕФтин, USAIDтин курагычтык жеңебиз, курагычтыкты дарылайбыз деген долбоорлордун алкагында мына биздин областтык ошол курагычка каршы борборунун бир топ баягы материалдык техникалык базалар чыңдалып калды. Мына өзүңүздөр көрдүңүздөр жана электрондук история болезнь бардыгы санариптештирилип, жакшы жолго коюлуп калды айтсам болот. Сиздерге рахмат.
Пользуясь случаем, уважаемый Марат.
Taking advantage of this opportunity, dear Marat, I would like to thank you because when the project we started working in our province, you led the fund, and I would like to thank USAID and Mira because during the project here at TB and at the previous project, you helped us a lot, and as a result, our provincial center could get relevant material and technical resources and thank you, Saginovich. Thank you for your valuable comments. So, and as for the split between payer and purchaser, of course, Salas province got its experience. So he mentioned data, gave you some information because they have worked for some years now. They are moving on to the next stage, and also we have provinces which are only beginning this process, and I would like to give the floor to the speakers from such provinces. We will have the whole team now, and I guess the discussion will begin with director of the provincial TB Center, Nur Jamal. Please, good afternoon, dear conference participants. We got a lot of useful information today. I'd like to say, so what our province is doing, we started working in February 2019. So with electronic TB register, and it really made our life easier. So I guess gradually paper-based operations will disappear, and we will only work with electronic TB register. So it will enable us to timely start treatment. And the key point for us is a TB patient. And thanks to the TB register, because of the links to laboratory components, so we can timely get TB test results, and we can start considering, and we can timely start the treatment and continue with case management. And now we are introducing at the PHC level, the electronic TB register is filled out by our district TB doctors, and we also can coordinate the process. If before we had to visit the district level, we had to review paper-based forms, and now we can in our offices see how the forms are filled out on the patient, how it all drugs are given, like how if the tests are timely done, and we can have everything for verification of the case. And when the treatment is finished, then the information is presented at the consilium, and we can take a look at digital case files, and we can either say no if, for example, some data are missing, and if, say, the treatment was not fully provided, and then, or we can verify and send documents for further payment. So electronic TB register, I guess, is important, because previously we were saying that we didn't have tools to improve our operations, to improve TB case management. And I guess this electronic system is that very tool we were missing before. It will enable us to interact better with primary healthcare level, so TB cases could be better managed. That's it. Thank you, Nur Jamal. Naren province is one of the provinces located in the mountains, high in the mountains, and definitely primary healthcare work is one of the most challenging. I would like to give the floor to Deputy Director of the PHC Center. Maria, please.
Bizde деле туберкулез кызматын алып барууда буга чейин иштеп келген, көп жылдан бери иштеп келген Айпешиналович деген врачыбыз бар. Туберкулезный служба Нуржамал Мамытовна деле билет. Ат башыда аябай жакшы жолго коюлуп, жакшы иштеп келгенбиз буга чейин. Бирок ошондой болсо дагы семейный врачтар, семейный медсестралар туберкулез боюнча сураганда эле Айпешиналович жооп берсин, туберкулезный врач эмне кылып отурат, ошо киши жооп берсин деп эле көп мындай маани беришпеген сыяктуу болуп, туберкулезный больнойлор бизге баш ийбейт, дарычысын ичпей атат деги бу деп эле көп ответтерди айтышчу да. Анан бирок бул быйылкы проектиге бизге кирип калган 202 буйруктун негизинде аябай жакшы болду бизге аябай жакшы болду, айрыкча жетекчилерге жакшы болду. Биз дагы семейный врачтардын, семейный медсестралардын иштегендер аларга стимул болуп, могу акчанын, айлыктын кошулуп калганы. Алар уже ответственный болуп, действительно ушу туберкулезный больной не только ли выявить этиш керек, оказывается, до конца доводить лечение.
Добрый день, уважаемые участники конференции.
Good afternoon, dear conference participants. For many years, we've been working in TB control, and we have honored doctor with many years of experience. And previously, family doctors and nurses dealt with TB issues. They tried to transfer those patients to the doctor, and now we could feel the changes. Starting this year, it become better for personnel and for managers, because now family doctors feel more responsibility, not only for case detection, but also for TB management.
Анын смертности болгону менен жаңы уябыт эткен боюнча проследить этебиз. Акыркы 3 жылда алсам, мисалы үчүн былтыркы мурунку жылдары 60-62 эле ортосунда болсо, 2020 жылы 60, а 2021 жылы 61 диспансердик учетто турат. Алардын ичинен 12си азыркы программага кирип, ошону менен иш алып барып атышат. Молудан 4-тө, Пулудан 1-ө, чувствительныйден 7-тө. Анын ичинен 4-тө онлайн менен чечет дарыларды. Семейный врачтарыбыз пока ушул ооруларга жетиштүү, семейный медсестралар дагы бар. Өздөрүнүн ответственностун сезет. Андан сырткары ай сайын мониторинг келет нарындан. Андан сырткары больнойлордун первичка документ менен, амбулаторный картасы менен консилиумга барып турушат. Контроль аябай жакшы, жумуш жакшы эле коюлуп калды. Лабораториядан анализ жеткирүү боюнча транспорт маселеси да чечилген. Дарыларды бир жерден гана бере турган аптека аркылуу централизованный кылганбыз. По назначению врача ар бир больнойдун дарысын бир айга чейин бөлүштүрүп неме бергенге, анан контроль аябай жакшы болуп жолго коюлуп калды десем.
Мария Чекировна, Чолпон.
Если мы обычно всегда следили...
If we normally monitor the patients covered with dispensary observations, for example, in 2020, we had 6 patients, and of them, 12 received treatment and 4 have TB and the rest TB, and they receive online treatment. I guess it's about video-supported treatment. And now they feel responsibility, and we conduct monthly monitoring. So this is done by provincial TB centers, and they visit our consiliums. And I'm pleased to know that now a transport company is used to transport sputum. Yeah, this is transported centrally to the provincial level, and as for drug supply, it's again centralized, and 1 month stock is provided.
84 жашка чыгып пенсияга кетем деп атат. Анан кайра кишинин ордуна башка врач тапканга аракет кылып атабыз. Ошол эле моментте ушу семейный врачтар менен семейный медсестралардын жанагындай туберкулез оорусун табууга да кайра дарылар акыркы немеге жеткиргенге дагы ответственный болуп калып, могу проектиге келип калганыбызга аябай сүйүнүчтөбүз. Кудай берсе, мындан ары дагы жумушталып кеткенге аракет кылабыз. Бардыгыңыздарга, сиздерге, фомустун кызматкерлерине, мадам Мусаевичтерге, сиздерге чоң рахмат. Бүгүн бизди дагы бир жолу ушу туберкулез службасын кандай приоритетине, кандай мындай бири-бирибизге иштеп аткан жумушубуз боюнча неме алмаштырып, мындай конференция уюштуруп бергениңиздерге, сиздерге миң мертебе чоң рахмат.
Тем не менее,
Nevertheless, we have a problem that our TB experts, which is 84 years old, they are planning to retire, and so we're looking for new experts to this position. In spite of this, the family doctors and the family nurses, they feel the responsibility for managing the patients with the TB, as well as for the detection of the new TB cases. So we'll do our best not to let down. And by taking this opportunity, I would like to extend my thanks to the fund, to Mr. Madamin Musaevich, that you were able to organize this type of meeting where we could get a lot of useful information. Thank you very much, Ms. Maria Chekirovna. Thank you very much, Olpan, for such an excellent consecutive interpretation. We'll take this into account for the future conferences. And I would like to mention that there are a lot of questions specific to the Council. I am from Narun, and we have a lot of, and I would like to give the floor to the director of the Naryn Territorial, to Mrs. Sinapokova. Good afternoon, distinguished participants. Conference. We are very happy to see you all, and all of us who are participating in this conference. Today we have all the representatives that will be organized in this very process. So in the process of implementation of TB management issues, we clearly understand today that in order to attain successful completion of treatments of patients with a resistant TB, first of all, we need to improve the detection of patients. And also we need to improve the indicators of successful treatment indicators. Probably this will be done by the health institutions, but for the fund, we need to ensure the well-grounded financing for managing the TB cases. We're just starting this very pilot, so we probably today learned a lot of good, useful experience from our today's conference, and we will definitely approach to this issue with great responsibility in this regard. Thank you. Thank you very much, Ms. Sinagul. Dear colleagues, it was a really interesting discussion, and according to our agenda, we have discussed. Are there anybody to take the floor? Please raise up your hand. Maybe there is anybody in the room who would like to comment. So we have examined all our footages. We have completed our study tour. And once again, I would like to thank Nuria and to Aybek on the footages. Aybek, please show him. When I introduced him, he was not in the room, but now he's here. He's our Aybek, the invisible soldier, who has been working over 3 footages, so you can see the results with Nuria. Once again, Nuria, thank you. Aybek, thank you for the work you have done. So now, distinguished colleagues, we have the coordinator of the Chuisk district, or region, I'm sorry. So when we speak about from colleagues from Uzbekistan, Tajikistan, we have to explain who is coordinator. And very often we make a synonym. This is our health department at the regional level. In Kyrgyzstan, we don't have the oblast health departments, but we have a system of institution of coordinators. So the coordinator of health is the person who is in charge of the health in the institution. So we have such coordinator, and Bakhtigul, please. Thank you very much, Mr. Marat. Good afternoon, distinguished colleagues, distinguished participants of the 5th International Conference, distinguished Ainur Sultanova, Madal Musayevich. Once again, good afternoon. I'm very happy to participate now at today's very relevant conference. I just wanted to note that, as Marat has mentioned, our Chuisk Oblast is one of the first regions that was participating in this very project. And we closely cooperate with the USAID project and with the HIV project. Now we're working with the TB and we're treating TB, and we're the pioneers in terms of implementation of these programs. And as our colleagues have mentioned from Narin, from other regions, from Batken, who just joined this very program, I would like to note that this program was very successful. And thank you very much for such great support. I would like to thank the USAID, Ms. Ainur Sultanova, you, the fund of compulsory medical insurance. It's a very unique mechanism when we have able to turn our faces to the patients. So in the cornerstone, it was a patient-centered approach. It's not a secret. And our attitude was quite effective. And maybe you had some biased approach to this in the past about family doctors when they were putting everything, all this responsibility for the doctors. So today, when the system has changed, I mean, the system of financing has changed. So this very stimulus and creating the environment when the family doctor and the doctors and the administration had this level of responsibility of such a high level. So I believe it's a very good accomplishment. So why we have selected this very region as the first one? Because we, being the Chuisk Oblast, it's quite a big oblast which covers or surrounds Bishkek, the capital, and we have quite big movements specific to migration of population, big problems with the over demography in the Chuisk. All representatives of the regions of our republic practically live and work in our oblast. So we had quite a complex epidemiological situation with the TB patients. Of course, the epidemiological situation has changed, and currently this very pilot project is working very well. And once again, I would like to extend my special thanks to all developers of this very unique method, the method of management of the TB cases, which is a patient-focused or patient-centered approach. So I hope our colleagues from other regions will also successfully implement this very system within their home countries. Thank you. Thank you very much, Bakhtigul Kushtarbekovna. And we have from the room, we can say already famous, the star of the TV, please, Zamir Rashidovna, the director of the TB hospital, Karabalta. Distinguished participants of the conference, good afternoon. I would like to say maybe the glance from the outside, being the head of the hospital. You know, TB, there was one program where that happened, integration of the TB and primary care. And this integration had happened only now. Throughout the years, we were unable to attain the participation of the directors of the primary care coordinators of the oblasts, so that they will be in charge for the TB cases. And I'm very happy to see now that there is an active participation by the family doctors groups. They all know very well their patients. They're in charge of them. And even the absence of the TB expert of the district is not that much reflected on the TB service. And I'm looking at this thanks to new method of management. So being the head of the hospital, I should say that during the first years when we just entered the system of unified payer, we were implementing the contract. And we concluded the contract to 300, then only 160 went through treatment. So then we start to understand, and then we start to perceive that the hospital tries to treat. We send to the clinic, to the outpatient, but then the patient comes again. And we'll be speaking a lot that the outpatient system is not working effectively. Hospital treats, but the primary care doesn't work. We treat, primary care doesn't work. So practically there was no synchronization. So now, if in the past we used to have overloaded beds, now the beds are empty. So there is very low percentage of the patients return again. I want to mention that this is not just a success in words. It's not just a hot air that the program is great. No, it's a practical. As a practical doctor, I'm telling you that this is worth doing. The system of financing has significantly changed the results of the treatment of TB. And one more very interesting comment. Where to start the reforms from? You can start the reform from the hospital, or you can start it from the primary care. You know what? In Kyrgyzstan today, outpatient treatment is working like half of its capacity. Hospitals are working half of the capacity. It's good. While the outpatient is working very effective. So we need to start the reforms with the primary care. When the primary care will take the responsibility on the TB patients and they start working, then these very excessive funds will be reallocated. The beds will be reduced. Thank you. Thank you very much, Ms. Zamira. Of course, Zamir Rashidovna, after so many years of reforms, to speak that, yeah, we need to, instead of the hospitals, we need to improve the primary care. Very interesting comment. But the reforms should go ahead, should go forward. And they should be adapted to our modern realities. Because sometimes we're moving forward on the way which is opening us new avenue of opportunities. So how could we start with the reforms in the primary care in 2012 when we were lacking the outpatient treatment? Because we understand the per capita financing, which cannot be used effectively in the TB treatment without relevant adaptation. Maybe that's why today we're quite successful. And practically today we have discussed all the issues, all the specific issues, presentations, footages. We have thanked the authors of the footages. We have thanked the presenters. And I would like to remind about our partners, participants from our neighboring countries. We will have a 20-minute break. And after 20 minutes break, we will listen to you. And we'll listen at least 3 answers to 3 questions. Which experience was useful for you? Which areas you were able to see as a promising ones? And what type of support or assistance do you need in these areas? I have a request to send the names of the contributors to the chat. We have representatives from Tajikistan, from Kazakhstan, from Uzbekistan, and Turkmenistan. So it's right now, as of Bishkek, 4:10. Uzbekistan, probably it's 3:10 p.m. The same goes for Tajikistan, 3:10 p.m. So I believe that 20 minutes will be well enough for us for the break. And I invite you. So at 3:30 p.m., we'll resume our work. And distinguished colleagues in Bishkek, at 4:30, we'll be waiting for you in our room, distinguished friends from Bishkek. Thank you very much. Break.
Уважаемые коллеги, мы продолжаем работу.
Dear colleagues, let's continue our work and please get connected.
Прошу всех подключиться. И, уважаемые коллеги,
And dear colleagues, we would like to give the floor to Dushanbe, and we will have questions, and there are participants who would like to comment. And I guess when we discuss countries, please raise your hands and we will discuss it country by country. So the first country is Tajikistan, followed by Uzbekistan, and the third country will be Turkmenistan. I would like to give the floor to Dushanbe. So, Zalidina Samudinov, Chief Expert of the Economic and Planning Department, Ministry of Health and Social Protection, Republic of Tajikistan. So please, Dushanbe, can you hear us? I would like to give you the floor. Good afternoon, Fazlidina Samudinov, Chief Expert, Economic and Planning Department, Ministry of Health and Social Protection, Tajikistan. With your permission, on behalf of the Ministry of Health and Social Protection, I would like to thank the leadership of the Ministry of Health of Kyrgyzstan for such informative presentations on health financing reforms. And it was our pleasure to see your videos about the health financing and the rounds of consilium for verification. So we would like to initiate the same reforms in your country, in our country, so they could be implemented in the Republic of Tajikistan.
So the parliament adopted the law on medical insurance in 2008, but in spite of efforts of the Ministry of Health and the Ministry of Finance and other ministries, we have postponed for 4 times the implementation of the fund in the Republic. And the major factor which we're not introducing in Tajikistan is the insufficiency of the budget funds. The compensation for the well, the major problem is the insufficiency of the funds in order to cover the needs of the people with the preferences. So for us, for further reforms in the Republic of Tajikistan, within framework of the treated cases, we're implementing the project, the draft of the resolution of the government, so that in the near future, in the near weeks, probably this very draft resolution will be approved, so that the Republic will introduce the successful treatment cases concept, so that we'll implement this very mechanism. Your experience of Kyrgyzstan was great, actually. We liked it very much. And in the future, we will be tracking your experience. Thank you. May I add some more information? Yes, sure. Please continue. My name is Sharipova, and many people know me as Natalia Babayevna. I work in the ethics project And as for the technical support of the ethics projects, we have established the working group with the Ministry of Health on development of the financing of TB. So all those who are present here, mainly in Dushanbe city, these are the members of this very working group, or the technical group, which is composed of not only the finances, but also it includes the TB doctors and the partners that are working with us in the system of financing of health, of the ADB project, experts working group, or the expert panel which works with the Ministry of Finance on financed by WHO, and the World Bank PUMA project, which basically works on the system of financing for the successful treated cases. So together with them, we are in contact and we're working, and they are present in all our meetings of the working group. Of course, the issues that you have asked, it would be really interesting for us to see the experience of Kyrgyzstan, of Kazakhstan, which has been presented. And we believe that these projects have great future, I mean, prospectively, as it was noted, maybe in some, and we're very happy that in your presentations you shared with us not only, how to say, experience and the positive things, but also you have shared about the problem issues that we basically will avoid to repeat. So, as we have discussed together with the members of the working group, and prior to that we have also had a discussion, the deputy chairperson of our technical working group is right now in the government, and the Ministry of Finance representative is not here today neither, I'm sorry, and they were developing a draft regulation on the introduction of the unified payer system in Tajikistan and financing the hospitalization for the successful treatment cases. So we hope that by the end of this day, it will be some result. We have also discussed this issue, and of course we need help in implementation of these prospective methods of financing. We need help from the international community, and should it be implemented by the primary care and DGR, I'm sorry, of course we need to build a good infrastructure. Secondly, and the representative of the Ministry of Health didn't mention this, of course we need to engage some other donors that can provide us with the informational, not only statistical, but also aspects. We also need some office equipment, because not only with the Ministry of Health, not speaking about the regional hospitals, we don't have the office equipment. Many of them do not have even internet to develop the network. Thank you. Thank you very much, Natalia Babayevna. Thank you very much, Mr. Fazludin Asamedinov. Are there any other comments or questions to our participants? And I really would like to get back to those issues that we have been speaking of. So as for the support and assistance, of course, you need help in terms of the office equipment, infrastructure. Which areas you believe promising? Natalia Babayevna. Well, oh, sorry, probably I missed to say that. Well, our country is moving towards the successful treatment case-based concept through the, and our TB service also is going to analyze and will go to this method. As you have mentioned about the primary care, we also would like, and we're already doing the first steps, We have developed and distributed the memorandum of the Ministry of Health. And one of the items of this very letter that the family doctors that are engaged in DOTS offices of the TB, that they will get 0.5 staffing units that they're working. They will get 100% remuneration because they work with in the risky environment with the TB. Of course, there are a lot of problems like transportation and many other things. And Alisher is there and he knows about this. We have developed the metrics based on which we have well-developed distribution of problems step by step, by dates, so that you can look and analyze everything in our group. About a year we're operating, and within 1 year, many things have been done in terms of our work in TB sector. And as I have mentioned, we're jointly working with our partners on financing. This is the only group, by the way, which has been established not in terms of the financing, but of health, but also in terms of TB sector. So we believe that the other hospitals, the donors, basically, that will be engaged in the financing will take the same path. Thank you. Thank you very much, Ms. Natalia Babayevna. I would like to continue this very discussion, and I would like to give the floor to Alisher Mahmudov. And in his comments, he's going to speak about this. And it will be really interesting to hear this from Alisher.
It was a very interesting day today. Thank you, colleagues from Tajikistan. Most interesting, if you paid attention. Well, actually, all items on the agenda today logically continue each other, and we had questions from our colleagues from Tajikistan, especially from Farouk, a very appropriate question about contractual relations. If the health department can act as a purchaser, well, the answer was also very correct because we can see the strategic directions have been identified, and as mentioned by our colleagues, if in the hospital level we work towards case-based payment, I guess it will be very useful for us to take a closer look at your experience in Kyrgyzstan with regards to contractual relations, like how to sign contracts, how to clearly differentiate between the purchaser and service provider. So those aspects were quite useful for us. I guess we can stop on that. And another area is that in Tajikistan, DRG for tuberculosis is not developed yet. And I guess in this area, we also need to review your experience, and maybe we need to adapt your methodology. So in our country, we could develop DRG for TB and gradually start using it. As for PHC, well, it's a more difficult issue because in the country, so far, we are lacking funds and restructuring is in progress. But in this sector, well, say in the beginning of this year, the resolution was adopted on the TB control system. Well, as for the exact amount of funds, it's too early to tell because we are not sure we can invest them in the strategic projects. But the aspects you've shown, like motivation, participation of concilium, and participation of each and every team member, stages, and salaries and payments. So I guess that's very interesting, and hopefully we can use it in Tajikistan. Well, where we will need support is further development of information systems, because now we don't have development of information systems in TB. We have various registers to support the process, but mostly treatment, but it's not about support to decision making. So I guess we need to elaborate on that further. And I guess we will need other methodological support, as I said before, development of DRGs, contractual relations, revision of clinical assignments for various actors in TB management. And I'd like to say that in Tajikistan, we have several leading agencies working in financing, and what I see now is TB is becoming a promising area, and it's becoming the flagship areas, and it starts acting as a driver for development of other areas to speed up the development in other sectors as well. And I guess our partner agencies will work with us, and we will contact you, our colleagues in the region. Thank you. Thank you, Alisher, for your message. And overall, Alisher, thank you for coming to Bishkek, despite the fact that we are online with Dushanbe. Alisher is offline here. He has been working with us in the last 10 days. He's been quite active in organizing our today's conference, and to continue this area. It is important to see how to do it, which area to progress. And I would like to give the floor to Ainura for more details. So thank you very much. Thank you, dear Tajik colleagues. I would like to draw your attention to day 2 of the conference, where our specialist Rahat Chaurova made a presentation on comprehensive reforms and TB care delivery. And she showed around which areas or blocks the work is concentrated in Kyrgyzstan. So our experience has shown that not only in the context of TB reforms, but also in the overall healthcare network and in other economic areas like social development or education and so on. So when one area gets disconnected, and if at the same time, or maybe if one area is ahead of others, and if others can't keep up with that area, then you won't succeed. Only comprehensive reforms taking into account multiple areas. We do understand that you can't cover everything, but you have to prioritize. But anyways, we have to talk comprehensive reforms. And if we in Tajikistan and other countries, so we need to work around those building blocks, and they were of great importance to us, like service delivery, financing, resources, and management or governance. And if we reach very good results, and if we are ahead of other areas like financing, then poor capacity, inadequately worked out care delivery, poor level of resources and information system, which is part of resources actually, or poor management, definitely will result in lagging behind overall. And I'd like to highlight that financing is one of the most powerful incentives. But anyways, You can't move on without structural changes in the system. You can't do without a revision of the service delivery system. You can't fail to revise some job descriptions. I don't know the situation in Tajikistan. Maybe as in our country, you had too many beds. And then if you bring it to conformity with the needs, if you harmonize it, I mean, it all should be done in parallel. So once again, of course, I am a great fan of reforms, but you have to be realistic and discuss it as a comprehensive set of reforms. And yes, and our colleagues from Narin province mentioned that the money has yet to come, but they are active in implementing various technology at PHC, which suggests that it's not always about money, but money is an important component. And I would like to give the floor to Farukh Igamov. Thank you very much. I would like to add to what Alisher and Natalia have said. So the point is that each new financing technique, as shown by other countries, is implemented as part of the health service procurement system. And that's for support. I would like to mention that under this event, we need to enhance the recently established unit at Provincial Health Department in Sub province. And we established that unit. We have 4 specialists there. And so they perform functions similar to procurement. Unfortunately, as for equipment and communications like internet and software, so far they have financial constraints, and we need to enhance their operations to ensure successful reforms in the pilot districts. At the same time, later on, that unit will continue to implement reforms in TB sector. Thank you, Farukh. Any further comments from Dushanbe? If there are none, and if there are no questions, allow me to move on to Uzbekistan, if you do not mind. If there are no objections, I would like to ask Tashkent to join us. And now we have Nargiza. We've heard Nargiza. No, actually, I'm here. Once again, welcome. I would like to give you the floor. So thank you so very much, dear colleagues. Once again, I would like to thank you for such informative messages, and it's all very interesting for us. Thank you so very much. Now I would like to give the floor to Deputy Head of our Mandatory Health Insurance, Zahid Shavkatovich, who's been with you since morning. Zahid Shavkatovich, the floor is yours.
Меня слышно, уважаемые коллеги?
Can you hear me, dear colleagues? Yes, we can, please. Good afternoon, dear conference participants. I'm not sure you can see me, but I'm happy you can hear me. It is my pleasure to participate in such a well-organized conference, where much attention is given to both TB treatment and the whole health financing system. I was pleased to see the experience with reforms in our neighboring countries, namely in Kyrgyzstan. We could hear opinions of our friends from Tajikistan, and we had a nice discussion with Clara Turgunbekovna last year, as I recall. And due to quarantine restrictions, that meeting was online, and I guess she was in a hurry because they had to develop some documents, and but she managed to worked with us for some time, and I'm really grateful. I would like to discuss the experience of Uzbekistan. We had the resolution of the president. In line with that, the pilot project in one of the provinces was launched, where we are implementing the project as recommended by WHO. So it's a comprehensive health reform, which includes both primary care level and hospital care, and financing system, digitalization. So it covers all the areas mentioned by Ainura Sultanovna. So the reform should be comprehensive. We are trying to cover district and city medical unions and provincial facilities. If we call it with the old Soviet Union, so those are provincial dispensaries. Now they are legal entities, separate, and now we are transforming them into branches of specialized centers. And in the one province, we are implementing it all. I was pleased to see experience of Kyrgyz Republic, namely that TB case management is organized around one vertical, which covers both PHC level and pay for performance, so case-based payment. I guess it's has a strong effect on personnel's performance because staff have their own incentives as they can see the results of their work, and they are willing to get even better results. And also I would like to highlight we are taking steps as well. The steps that were taken by Kyrgyzstan, and in your presentations, you've shown compensation for outpatient drugs, which we are currently working on. And of course, it all relies on digitalization. And it's not implemented as fast as documents are written, for example, because regulatory documents are always ahead of us, and the implementers, those who have to translate that into reality, we are lagging behind, unfortunately, but this is the work in progress. Also, I would like to give the floor to Chief of the Funds Department, responsible for working with health facilities, and this department is engaged in reforms on medical aspects. Umida, the floor is yours. So, colleagues, I'd like to welcome you. And Zahid Shavkatovich has said that it was my pleasure to participate in this session, in this conference. And I would like to say that, yes, we have only started. And we have just initiated the pilot project in Sirdarya province.
So today's presentations were really useful for us. And to the questions like which experience was useful, I would like to mention that the experience of anti-TB Republican hospital, which you have demonstrated, as well as the virtual visit to the team, was extremely useful and interesting. We liked it. And we are planning to, for the hospitals will be treated cases, and as for the per capita financing in the primary care. But today I've seen something different, especially on the treatment of the TB. The treatment of TB, starting from the primary care up to the hospitals, is really matters because population first goes to the primary care. And in the primary care, we have teams that, based on our documents, we have organized in the primary care, these very brigades medical brigades. And these very medical brigades actually include our nurses that will be really useful to see. The family clinic that we have demonstrated, the family group practice, because we do have the activities with the TB. We also treat TB patients starting from the primary care, and we also distribute the drugs. But the payment remuneration to these team members, that would definitely stimulate, and this will produce the impact to reduce the TB prevalence. Thank you.
Спасибо, Умида.
Thank you very much, Umida. Thank you, Zahid Shevkatovich. Distinguished colleagues from Tashkent, do you have any other comments?
Добрый день еще раз, Марат. Я
Once
думаю,
again, good afternoon. I think no, we don't have any more comments. In general, our today's session is moderated by you, and it would be correct if you will lead it to the logical closing. Thank you. Thank you, Nargiza Nusratovna, for your warm words and for giving us the functions of moderation. We have Turkmenistan left, and because of the technical causes, they cannot make the online session, but we can read their statement that they submitted to us. And I would like to request Rahat to read out their address. The statements were the address from the colleagues from Turkmenistan. It's a great honor for us to participate in today's very important conference. From the date of the independence, Turkmenistan has become one of the first countries that adopted the strategy on counteracting TB and to introduce DOTS program. Recent years, in the area of tuberculosis in Turkmenistan, there happened many positive changes. The national program has become very powerful, and we're working over the increasement of the interest of the patients to the treatment. It provides the patients with the good, safe treatment. In Turkmenistan, always considered health as one of the important areas, and it has been introduced a number of investments into this sector. Recently, it has invested a significant amount of money into this very sector. We're updating the TB treatment documents on a regular basis. For Turkmenistan, treatment of TB is very much important. The National Program on Prevention of the TB in Turkmenistan for 2016-2020 has been completely complies with the European region of WHO. And the President attaching very serious importance to this. And we're enhancing the database, and we're introducing new methods of treatment. Accessibility of the TB drugs, as well as introduction of the new methods. Considering the accomplishments we made, with the great enthusiasm, we support the idea of enhancing the measures to prevent and treat TB. Being the part of the European region, we fully support the activities until 2025. Today, we'll be working with the countries of our region and the entire world to stop TB. The counteracting TB has not finished yet, and it's in our hands. And it's a small piece of information on the new schemes of treatment. By February 1st of 2021, 14 patients out of 46 in June 1st to 31st of August have been treated. 2 of them are teenagers. I don't see the figures well, sorry. 1 patient is completing the treatment with the fibrosis foci. Dynamics is 85.2%, and they're providing a list of the after effects. Well, I think that's it. Thank you very much, Rahat. Thank you, Rahat, for reading out the address of Turkmenistan. So, Rahat, on behalf of Mohamed Kuliyev Imaral, the Center of Treatment and Prevention of the TB, Department of the Communicable Disease of Turkmenistan. Distinguished colleagues, we completed our today's program. We have presented a lot of information, a lot of materials. We have conducted a very interesting discussion, but again, this is done for the first time. This was a virtual tour that we've had for the first time. I think that ahead of us, not virtual, but a real tour where we can share the information. When the colleagues from Uzbekistan have voiced the areas which are currently being actively promoted in Uzbekistan, we really like it, and how to promote this and what type of results can be obtained. And it was really interesting to hear your opinion. We have listened to a number of presentations from Kazakhstan about the implementation of new systems of codification, of comprehensive financing, especially for the TB service. Well, seems the instruments are similar, but we can see that there are a lot of differences too. Well, distinguished colleagues, we're going to the closing part. If no more comments, somebody has raised up the hand. Rahat, please check. Are there any hands up? No? Okay, then distinguished colleagues, then we're going to the summarizing part. And for summarizing of the entire day, and the day was very productive, I would like to give the floor to Aynura Sultanovna for comprehensive and solid conclusions on our today's virtual tour. Please, Aynura. Thank you. Well, first I want to say, and I would like to extend my thanks to the Ministry of Health and of all 5 Central Asian states, because without the political will, this type of conference would not happen. Great things has been done in the area of, in terms of providing information by the centers, TB centers and hospitals and services of all 5 countries of the Central Asian TB services. In today's session, we had active participants from the Ministry of Finance, the fund of the compulsory medical insurance. So basically we engage the finances too. It has become possible thanks to technical assistance and support that was rendered by 2 projects of USAID. The first one is the Central Asian or regional project, Ethica, and in Kyrgyzstan, we had another USAID project, TB treatment. Well, today we have succeeded in demonstrating, well, believe me, this is just the information collected into one presentation or a couple of footages. The entire cycle, how the treatment starts and formed, starting from the strategic areas up to the most technical details. And this very cycle of financing of anti-TB services in the country, such as TB control service, as well as the primary care activities. In the presentations, in the footages, everything looked very seamlessly, very smooth, like very easy to do. But in reality, I believe you will agree with me that, firstly, it is a very long and winding process. Everything started somewhere from 2015, 2016. I think I'm not wrong. Starting from the 2015, 2016, we've started all these activities, and the switch of the TB service to the unified payer system in 2012, actually. And the fund started to introduce its instruments, but the intensive development of all these methods of financing on anti-TB services have started about 2015, 2016, actually. And all of this have been accompanied with the compulsory structural changes, because without structural changes, as Clara has mentioned, I wouldn't think that Kyrgyzstan would be able to find that a reserve, because quite often on the eve of the formation of the system, when we were lobbying the mechanisms, the fund of mandatory medical insurance and the Ministry of Finance, they said, oh, super, fantastic, but no money. Let's be more effective in terms of disbursements. So in reality, we selected a very pragmatic and quite complex approach when within the system we were searching for not that effectively used funds, and it helped basically to save funds that has been reallocated. So that's what we have shown you today. Now in reality, we had a lot of many other plans. There are certain services which are still covered either by the balance cost or from the budget of the Department of Health or by the global funds. There are many such services. So there are many so-called gray areas to resolve. But as for Kyrgyzstan, we have clear and accurate vision regarding the anti-TB service within the state guarantees. And the financing of anti-TB services within the general financing from the budget. We're also forming the electronic informational systems within framework of the general system of electronic health or digital health, which is currently being developed. So all these reforms happening in the anti-TB services, they're not happening in isolation from the general priorities in the country. Otherwise, it's simply impossible. And it has to be linked with the total relevant areas of reforms in health that are well reflected in many political documents, of high-level political documents, as well as at the level of the decrees and the presidential edicts. Today, we had a chance to hear not only the executive agency representatives, we also had a chance to listen the providers working in the primary care, in the area of the outpatient treatment, which are carrying out the activity in terms of the coordination of this various systems. And of course, I believe that this is quite a big accomplishment, that today we're able to identify, first of all, the clear functions. Secondly, we're able to identify the financing of these very functions, how it can be financed. Many things has been done, more things ahead of us. And we were able to demonstrate you almost like 5% what has been done so far based on our big material. So as Alisha has mentioned, and actually it's planned the offline visit to Kyrgyzstan, and I believe during this very visit we'll be more than happy to show you everything what we're doing, and we'll be answering to your questions which appear and that you can submit to the electronic channels, I mean your requests, and we are ready to answer the questions. We'd like to thank you all. I would like to thank all the participants that we have seen online. These are colleagues from Uzbekistan, from Tajikistan, and colleagues from Turkmenistan. I'm also very happy to see you. Yeah, unfortunately, we didn't have a chance to get connected, but we heard you. We've seen you in the chat. So we salute you. Thank you very much, and see you next time. Thank you very much, Ainur Sultanova, distinguished colleagues. So I believe that I would like to praise Ainura Sultan as a moderator. We're just, in terms of timing, X marks the stops. X marks the spots. It's like 4:20 Tashkent, 5:20 Bishkek. And for the closing, I would like to give a floor, because we're speaking a lot about the financing, to the deputy chairperson of the, to Ms. Clara, please. Dear colleagues, dear our colleagues from our neighboring countries, on behalf of the Minister of Health and the fund of the compulsory medical insurance, I would like to tell you, each of you and all of you, thank you. I would like to thank the TB project of the USAID, who helped us to organize such an outstanding international workshop. Personally, I would like to say that I would like to thank the Republic of Uzbekistan and Mr. Zahid Shavkatovich, who is just introducing the system of compulsory medical insurance. I would like to wish you great success in your endeavors. Thank you very much. As Mr. Ainur has mentioned, we are open for discussion, we are open for a dialogue and for cooperation. Thank you. Thank you, Ms. Clara Tolgobekovna, distinguished colleagues. At this note, let me close our today's conference. I would like to wish all of you strong health in all our countries, so the dynamics of the TB prevalence starting from tomorrow will go down. And after a year, we'll be able to see how we were able to accomplish extremely low level of prevalence that we can be proud of before the other countries beyond the Central Asian region. Distinguished colleagues, it was really nice to talk to you, and this very communication was very pleasant, both online and offline. Once again, I would like to wish you strong health, and see you next time. Goodbye. Goodbye. Thank you.